Tap the gavel. Good afternoon, everyone. Welcome to the April 18th, 2024 Baltimore City Planning Commission. My name is Sean Davis. I have the pleasure of chairing the commission. Sitting to my right is Chris Ryer, the Director of Planning and Secretary for the commission. Mr. Secretary, will you call a roll?
Robin Allen.
Present.
Marcia Collins.
Present.
Honorable Eric Costello is not present yet. Talib Horn is not present. Claudia Jolin.
Present.
Doug McCoach.
Present.
Justin Williams is not present yet. Eric Stevenson.
Present.
And Sean Davis.
Present. We have before us our meeting minutes from our March 28th, 2024 meeting. Any questions or comments regarding those? Hearing none, do I have a motion?
Move approval.
Thank you, Commissioner McCoach. Second?
Second.
Commissioner Allen. All those in favor? Aye.
Aye.
Any opposed? Any abstentions?
Abstain.
Thank you very much. We have, moving on to our consent agenda, we have CIP transfers from April 3rd. There were 12 items on this. Are there any questions?
One question, Mr. Chair.
Yes.
The April 3rd meeting, item number 4, it's a $2 million transfer from the Gwynns Falls Sewer Shed Project to Jones Falls Sewer Shed Project. It states that the funds were no longer needed for the Gwynns Falls project.
And are being used for other projects.
So my question is, who makes the determination that the funds are no longer needed for the allocated project? And is any of that information shared with us? I guess I would like, it could be that the project was completed under budget and these are remaining funds, which would be reasonable. Or it could be that someone decided not to complete the, just would like
The
to know
full scope
the
or
full
whatever.
scope. And then, additionally, I think it raises the question, when funds are not used as allocated, what's the review process to reallocate those funds?
Or is it just left to the agency's discretion, saying, okay, we're not going to use these, we don't need these for that particular project, so we're just going to take them back and use them for other projects, when there are multiple other agencies that have, we're clamoring for money, why wouldn't that $2 million go back into the pot and be looked at amongst all the agencies?
This case, it's a little bit of a simpler answer in that these are restricted funds, right? These are dedicated funds for water and wastewater, so they could not be moved to a different agency. But that doesn't respond to your question about the project within the agency or the status of the one that was ostensibly completed.
And I'm also concerned from an equity standpoint, because there's a geographic impact when we look at how the money is being spread across the city. The Gwynns Falls watershed is an area of concern for a lot of our residents, and seeing money move from Gwynns Falls to Jones Falls follows a certain pattern.
Very legitimate point. What I would suggest that we do is I will follow up with an email to Kristen and ask her to put this on a future briefing session in the short term so that we can understand policies and how those decisions are being made. Make sense?
Yeah.
Mr. Chair, if this one's being moved off the agenda, I just want to make sure I record it correctly. Which item is it again?
It's not being moved
Fourth.
off. I think Vice Chair Stevenson is simply raising a question about it. I don't know what, I'm not going to go as far as to say he doesn't want to approve this particular one. I just think he's raising a question. Hey, this was part of it now. So, okay. I think he was using that as an example, not as a specific.
Sure.
The fourth item on the third.
Okay. So let's do that. Sean, Chris, okay, I will follow up on that. With that, are there any other questions regarding the April 3rd CIP transfers? Hearing none, do I have a motion?
So moved.
Is that Commissioner Collins?
Yes.
Okay, second.
Second.
Thank you. All those in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Next, we have the April 17th CIP transfers, there were 5. Are there any questions or comment regarding those? Hearing none, do I have a motion?
So moved.
Thank you, Vice Chair Stevenson. Second?
Second.
Thank you, Commissioner McCoach. All those in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Next, we have minor subdivision final plans for 1110 through 1112, 1126 through 1128, 1130 through 1132, 1111 through 1113. Man, that's a mouthful. Shields Place in the 11th District. Any questions or comments regarding this? Hearing none, do we have a motion?
So moved.
Thank you, Commissioner
Excuse me.
Collins. Second?
Second.
Thank you, Vice Chair Stevenson. All those in favor signify by saying aye.
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 Any opposed? Any abstentions? Next, minor subdivision final plans for 2401 through 2409 Linden Avenue in St. Francis Neighborhood Center. It's in the 7th District. Questions or comments? Do we have a motion?
Motion to approve?
Thank you, Vice Chair Stevenson. Second?
Second.
Thank you, Commissioner Collins. All those in favor signify by saying aye.
Aye.
Any opposed? Any abstentions? Finally, on our consented final subdivision, revised final design approval for 850 West North Avenue, Parcel A, Reservoir Square in the 7th District. Any questions or comments regarding this? Do I have a motion?
So moved.
Thank you, Commissioner McCoach. Second?
Second.
Thank you, Vice Chair Stevenson. All those in favor signify by saying aye.
Aye.
Any opposed? And I will abstain. Okay, now moving on to our regular agenda.
First item on the regular agenda is City Council Bill number 24-0498, a rezoning for 3014 to 3030 Darby Street East, 3021 to 3039 Elm Avenue, 800 to 810 Darby Street South, north side of Darby Street South, adjacent to 810 East, 3000 to 3012 Darby Street East, and 3000 to 3019 Elm Avenue. In the 14th Councilmatic District, Marie McSweeney Anderson will present.
Good afternoon.
Good afternoon. I feel like you all are getting a lot of my first. So this is my first rezoning. So thank you all. Hopefully it won't be too difficult of something to mull over. You all know me, Marie McSweeney Anderson. I'm the Northern District Planner. To make it a little bit easier, this is the area we're talking about outlined in yellow. So it's Darby Street, east and south. Mill Road is up above. And then Elm is to the west. So you'll see right now it's currently zoned at R7. This is the previous zoning. The whole area was zoned R7 previously, but with the update, you will see that some areas have been zoned R6, and then to the north. Is it on?
Which button notes not?
There you go.
Sorry, Ivor.
Well, he wasn't yelling at me, so that's okay.
As I was saying before, it is currently zoned R7 with the update. Areas to the east are zoned R6, and areas to the north have been zoned R8.
Well, go back. Okay, so there's a couple blocks on the north side that have been R8, but it's also was down zoned to R6 too. Okay, thank you.
Yes. So this is an aerial view. You can get a pretty good look at the lot lines, and pretty much all of the properties are non-conforming to R7. It's right next to Mill Center, Mill number 1. And so essentially rezoning from R7 to R8 would mediate some of the nonconformities. It would not mediate them completely, but in order to do that, the entire area would have to be rezoned to R10, which is not appropriate for this area. So a lot of the issues here really have to do with additions to the back of the properties. They're longstanding additions that really put them into nonconformity. And this is one of the issues that folks are running into when they're going and wanting to put additions onto their property and not being able to get variance requests. So this would, as I said, mediate some nonconformity, but not totally. Equity impact, it would support the residents who are living there now. We don't anticipate any huge developments happening, any change in property ownerships. As far as engagement, Councilwoman Ramos did reach out to every single property owner. She met with 3 property owners, but there was no issues with folks who didn't want this to happen. And then as far as internal operations, there may be a decrease to staff time, depending on the variance requests that are coming through. So we don't anticipate huge changes. It does align with the R8 zoning code definition as a row house property. The R7 definition is a little bit more all-encompassing of some detached houses as well as non-detached. R8 is solely row house development, so it'll get it better, not perfect, but we're recommending approval.
Great, thank you. Questions? All right, let's go down. Start off with Commissioner Jolin.
Yes, thank you. So can you tell me how many of the properties, I know you say you're not going to be perfect in right sizing, but that would fit into the R10? Like how many are outside of, let's say we approve it to R8, what is still left over?
I was like, we knew this question was going to come. So the lot size coverage for R7 is 50%. 0% of the current properties meet 50%. For R8, it's 60% of lot coverage. Some will, not all. The true answer is a lot of them are non-conforming. I haven't done a study on every single property. I can give you one example, though, if you want.
Oh, please.
Then the other practical reality is a typology going to R9 starts to become a lot more dense, and it's not exactly the goal for this type of built environment. So even if it were to numerically solve more of the numbers, it's still probably not a good fit.
And R9 has setback requirements, which this does not meet. So it's just barely meeting the requirements for R7. So the lot size requirement for R7 is 1,100 feet. This is just over 1,100 square feet at 1,176. The R8 is 750 square feet are required. And like I said, the percent coverage for R7 is 50%, and the requirement for R8 is 60%. So it doesn't get it much better, it gets it a little bit better, but.
Any other questions, Commissioner Jolin?
No, thank you.
Commissioner Collins?
Why are we doing this?
Thank you, yes.
Since we're not correcting any and all problems, but if we could correct them, it wouldn't work for the existing structure. So why are we doing this?
I was like, the sponsor's not here. So mainly due to the changes with the operation of BMZA. And we have a property owner who's here to testify and support that it would support the work that he's doing on his home.
I'm confused.
So
Does that, hold on real quickly, does that address your question, Commissioner Collins?
I don't think so, but okay.
So it would reduce the variance requests coming to BMZA. And there's some legislation that would also change the minor and major requests going to BMZA. So with allowing for greater lot size, it would reduce the variance asks of the property owners.
And
And
real
the
real
coverage.
quickly, if I can, recently, the BMZA has taken a very, very specific position on what is considered a variance and the unique hardship standard, which is in a little bit of flux. So a property owner in this neighborhood wants to add an addition or wants to renovate an addition, has to get a building permit. It's considered non-conforming. They have to go to the BMZA for approval. They go to BMZA, and because it's not, they can't justify the specific legal requirement, their application may be denied. And so, in an effort, I would assume, to at least modify as much as we can without opening Pandora's box into the R9 or R10 zoning category, you're trying to make it better, but recognizing that you're not making it all well. Is that a
So-
fair,
May I add one more
please?
thought? I think the simpler answer may be, well, this doesn't address existing nonconformity. People who want to do additional work or build a new addition would have some opportunity to do so and make it conforming. So I think that this,
So, but wouldn't, if we change it to R8, wouldn't it allow them to seek a variance to the R8?
It would. I mean, but the variance may be significantly less in terms of our lot coverage requirement. Right now I'm at, at 50% or 57% lot coverage, I'm not conforming to the R7. I am conforming to the R8. Now I go for a variance to add an addition, and now I'm at 61%. Well, my variance is only 1% above the 60%, not 11% above the 50%, right? It's semantics, but those kinds of percentages matter.
also the fact that all my neighbors already have a non-conforming addition isn't good enough legal standing in BMZA's eyes to grant the next property owner addition, even though that may seem like a common sense thing. The thinking is that since all these houses are the same and they all have the same, condition and circumstance, instead of doing this one variance at a time, if we want to allow this sort of thing, we should update the zoning. If not, then it won't be allowed.
And this was instituted by the council member herself, not at the request of any particular property owner. Because the one thing I was going to point out is I would consider this more of a small area plan zoning amendment versus a rezoning, because there's not one individual property owner. This is covering a small area with multiple property owners. Therefore, I don't think that, in my opinion, as such, the change of mistake rule applies, because it's no longer considered a rezoning in the context of a property owner application. It's a council person application. So I think some of those standards kind of go to the wayside, and that's my own personal opinion. So Deputy Mayor Williams, A, welcome, and B, do you have any questions?
And no questions, thank you.
Vice Chair Stevenson, anything further?
No, thank you.
Commissioner McCoach?
Yeah, our question, the shift to R8, does that inadvertently permit changes that down the road would have a negative impact in terms of use or density? Let's just say that half of those buildings, for some reason, weren't there anymore.
Right, yeah.
Would we be opening the door to consequences that we couldn't imagine today by making that zoning change?
So the only change in use is for rooming houses of 10 or less. That does allow it to be conditional by board. But other than the bulk standards, that's the only change.
Okay.
Commissioner Allen?
I have no question. I just want to thank you for your explanation. That helps.
Great, thank you. Thank you very much. Is there anyone here who would like to speak on this agenda item? Seeing none, I close the public hearing. Any questions, comments, deliberations, discussion amongst the board, amongst the commission?
I just commend the councilwoman. We should do more of this sort of proactive problem solving.
I agree. All right, with that, do I have a motion?
Motion to approve?
Thank you, Vice Chair Stevenson. Do I have a second?
Second.
And I would imagine that motion adopts the finding of fact and conclusions of law as stipulated in the staff report. Correct?
Yes.
Thank you.
I would suggest well, I guess the findings of fact would include the explanations added.
All right, with that, Mr. Secretary, will you call the roll?
Robin Allen,
Approved.
Marcia Collins,
Approve.
Claudia Jolin,
Approve.
Doug McCoach,
Approved.
Justin Williams,
Approved.
Eric Stevenson,
Approved.
and Sean Davis.
Approved. Next.
Next item on the agenda, City Council Bill number 24-0501, is zoning conditional use conversion of a single-family dwelling unit to two dwelling units in the R8 zoning district with variances at 1833 West Lexington Street in the 9th Councilmanic District. Eric Tiso's presenting.
Good afternoon, Mr. Chairman, members of the commission. This is indeed a conversion for two dwelling units. So here's the property in the middle of the block. There are two vacant properties in that block immediately to its west. So there's the property. Looking at it from the rear, it's a three-story building. And there it is, the bright white roof just to the left of the green. And so when we look at the conversion standards, in some ways, this is simpler than many that we see. This property had been previously lawfully established as two dwelling units, and then a prior owner in 2008 pulled a use permit to reset it back to single family. Unfortunately, the property was sold somewhat soon thereafter. No physical changes were made in the building. The building has been continually occupied as two dwelling units ever since. So this discrepancy was recently discovered, and that's what triggered this conversion request to now re-legalize those two units that have been in existence continuously. So there are some variances that are required for this, a slight lot area variance. I'm sorry, I have a typo where I says, in my staff report where I said it's not approval without a variance of the requirement. It does in fact meet the lot area variance. I'm sorry, that is an extraneous not there. There is a variance required for parking because the property is too narrow. It can't provide or it does not now provide a parking space to serve the second dwelling unit. There is theoretically space in the rear yard that could be converted. But at this point in time, since it's been in active use as two dwelling units for decades, it's no additional impact on the community if the variance were to approve the existing condition without it. So looking at the standards, we think it's fairly easy to meet because it's already in operation. It was once approved lawfully as two dwelling units until a prior owner took that away. Over time, we've seen this with some degree of frequency, especially when somebody wants to avoid having to pay a multifamily dwelling license. For whatever reason, they would reset it. So I go through some of the numbers here, which I already mentioned to you, without just saving that parking variance. Otherwise, it is as it sits today. And so staff recommends approval.
Thank you very much, Mr. Tiso. For the record, the property was properly posted.
Yes.
And we have a letter of support from the Franklin Square Community Association in our materials. With that, I open it up for questions for Mr. Tiso. Commissioner Allen.
No questions, thank you.
Commissioner McCoach.
No questions.
Vice Chair Stevenson.
One question, and to be clear, I take no exception to the proposal. My question is about our off-street parking requirement. How many spaces would be required?
One extra, because presumably there was one dwelling unit that was there since prior to 1971 before parking was required. So a second unit would require one additional, because that's the intensification of use. There is theoretically room in the backyard to provide it. It's never been done. It was once approved as two units without it. And so they're asking for a variance instead of providing it.
So hypothetically, and again, I'm in support of the variance in this case, but I want to understand. The total number of off-street parking spaces for two dwelling units would be 2 spaces.
If it were a new construction with no use there, yes.
but a single-family house doesn't have any off-street parking requirement.
Because it pre-exists, the original single-family dwelling pre-existed the 71 code that required parking, so it was waived because it was an existing condition at that time.
Does a new construction single-family require an off-street parking?
Yes, so if you were to demolish this building and build a new two-dwelling unit, yes.
But what about a one-dwelling unit?
It would still have to provide parking because it would be a demo and new build.
Understood. Thank you.
Yep.
Deputy Mayor Williams.
No questions, thank you.
Commissioner Collins.
No questions?
Commissioner Jolin.
No questions, thank you.
My only question is, and forgive me for not having an opportunity to read the council bill for this. Does the council bill need to be amended for the variance for the parking?
No one includes it.
It does, okay,
Yep.
great, thank you. Thank you very much, Mr. Tiso. Is there anyone here who would like to speak in favor or in opposition on this agenda item?
Okay, I think
Seeing
we have the
none.
applicant here if you need any questions, but otherwise, no.
Nope. Okay, and close the public hearing. With that, commission deliberations, any questions, comments, discussions amongst the commission? Okay, seeing none, do we have a motion?
Motion to approve?
Thank you, Vice Chair Stevenson. Do we have a second?
Second.
Thank you, Deputy Mayor Williams. Mr. Secretary, will you call roll?
Robin Allen,
Approve.
Marcia Collins,
Approve.
Claudia Jolin,
Approve.
Doug McCoach,
Approve.
Justin Williams,
Approve.
Eric Stevenson,
Approve.
and Sean Davis.
Approve. Next.
Next item on the agenda is City Council Bill Number 23-0442, a rezoning for 2220 Reisterstown Road in the 7th Councilmanic District. Therese Bolden will present.
Hello, good afternoon.
Good afternoon.
And like Marie said earlier, this will be my first, so I appreciate that. Thank you, everyone. This will be a request for the purpose of changing the zoning of the property at 22 Reisterstown Road from a C2 to a C1 zoning district. As you can see on the map, it's highlighted, well, it's actually not highlighted, but it's fine. It's on the corner. Thank you. It's on the corner of Windsor Avenue and Reisterstown Road between Elgin Street. It's in the neighborhood of the Mondawmin. It's on the eastern edge of the Mondawmin neighborhood. The property itself is about 2 blocks away from the Parkview Rec Center, and it's about 4 blocks south of Mondawmin Mall. The area is also directly adjacent to the West Impact Investment Area. The property itself is an 18,000 square foot property on about a 30,000 square foot lot, currently vacant, and it has the number of parking where it is. The property itself has been used for a number of different uses, was built in 1954, and has had a number of auto-related uses at the site. The view to the east shows there's also a number of commercial, small-scale neighborhood commercial properties just west of the site and north and south of the site. It's in an emerging area. There are a number of projects that are being developed through DHCD, through the impact investment area efforts near this location. The zoning right now is currently C2. It is bounded by C1s on both sides, and is an R8, so on the other side is predominantly a residential neighborhood. The previous zoning was a B32. The area was, at one point in time, as Mr. Tiso explained to me, a highway commercial area, very dense industrial / high-intensity commercial zoning, which is then downzoned to the C2, and as well as some of the areas above that were turned into R zones, as well as down to a C1 in this particular area. This particular graphic shows both the original zoning and the new zoning that was put in 2017. Based on the proposal, the Department of Planning looks at what are the actual standards for rezoning at a particular site, using these metrics to determine whether or not a rezoning is warranted at that particular location, whether or not it meets these required findings, and whether or not it meets these standings. Looking at the actual standings involved and looking at the property itself, we determined that there is no particular reason to actually recommend a approval of this rezoning at this particular site due to the fact that it would be constituted as a spot zoning on the location. It's a very brief presentation, but we just went right to the point. Are there any
Sometimes when you
questions?
say no, it's okay to say it quickly. Or when you recommend no, I should say. Are there questions for Tariq? Starting off with Commissioner Dolan.
Can you speak a little bit more on the intent to change it to C1? Can you just tell me why?
The sponsor is here.
The sponsor is here and they can speak to as to why they wanted to change it to C1.
Anything else? Commissioner Collins?
No questions.
Deputy Mayor Williams?
No questions this time, thank you.
Vice Chair Stevenson?
Do you know what the current use of the building is?
What'd you say,
I think
Mr.
is the owner of the property here.
Yeah,
Mayor?
it's a medical clinic.
Okay,
Well, right now
hold
it's.
on. We gotta keep order.
No, sorry,
So if you don't know, that's cool.
sorry.
So we'll wait.
We'll wait until I'm sure
the
he'll
applicant
speak
comes
at
up.
some point.
All right?
Okay.
Any other questions?
As the community planner, good to see you, by the way. What is the community taking a position on this rezoning, support or
There's been,
opposition?
we've found that the community has some mixed support. We've got a number of community groups we've spoken to, both the Mondawmin and the Arthur Charlie Terrace Association about this, as well as the Greater Mondawmin Coordinating Council, which has been in favor of this, the rezoning of the property, as well as there are various community members who also feel like this may be going too far. So it depends on who you ask, but overall, from neighborhood associations, we found strong support for the rezoning of this property.
And do you have any idea why there's support? What's the understanding of why the community is supporting it?
I think we'll let the sponsor speak to as to why that is.
From what I understand, it's a use issue.
Yeah.
There's been-
Understood. I'll let the sponsor speak to that. Thank you.
Commissioner McCoach?
I'd like to hear from the applicant. No questions for staff.
Commissioner Allen?
Yes, what is meant by the councilman introduced this as a hostile rezoning bill?
I think we'll allow the Councilman Torrance is here. We'll give him an opportunity to speak. One second. Thank you. Are there any other questions for Tariq? Okay.
All right, thank you.
Real quickly, was the property posted?
Yes, sir. The property was posted on Monday, 10 days at 6 p.m. I have posted, and I have pictures verifying. I posted it myself at that time.
This Monday?
No, this past Monday.
So it was properly posted?
It was properly posted.
That's all I have for you. Thank you very much. Councilman Torrance, please come up.
Thank you, honorable members. It's good to come across the street again and see you guys again. To be clear, this is not hostile. This is in alignment with the Greater Rosemont Mondawmin actual master plan. The master plan outlined that the corridors will be for economic clusters with actual persons being able to walk to those properties. To be clear, the TOD, the actual recommendation for C1 is consistent with the other blocks that were C1, but this is a mistake from Transform Baltimore. I'm going to be transparent that the previous city council did a wholesale change without actually looking at the master plans. And they did spot zoning then as well. To be frank, my colleagues did not pay attention to the master plans that we spent thousands of dollars to work with neighbors to actually coordinate and create. In addition to that, the clinic that is proposed would be better proposed for another area. As we have primary care moving into the Mondawmin Village, which will be happening sooner than later within this year. In addition to that, a new pharmacy, which was also another proposed use. In addition to that, that facility will be housed with senior health care, which through the PACE Center, which we fought hard for to bring to West Baltimore. West Baltimore does have a healthcare desert. That's for primary care. In addition to that, we are moving the women's health clinic, or what is on North Avenue, to the Old Providence Hospital so that we can affirm the care of Black women in West Baltimore and the city of Baltimore to get mammograms as well as pap smear for free through our city agencies. The current cluster, as we see it now, is inconsistent with the will of the people in the neighborhoods there. I come to you because your own staff will eventually recommend to you TOD1, which is consistent with the C1. I think that this is a conversation for the commission to figure out whether or not it wants to move forward with that C1. I'm happy to take the recommendation of amending my bill to be TOD1. However, this is not hostile. This bill is in alignment with the members of the community who are here with me today. This is in alignment with affirming Black citizens in West Baltimore. And this is after a conversation that we've had with neighbors. I ask that you approve it. I do know that this is advisory, and I will say this. I have started whipping votes on the Baltimore City Council to pass it through legislation.
Which is your right.
Thank you. But I have firmly laid out a plan that will work for this neighborhood as well as inconsistencies that we've had before so that our neighbors feel affirmed and seen. I'm happy to answer your questions.
Thank you very much, Councilman. Questions for the councilman, starting off with Commissioner Allen.
Councilman, you said the community wants the C1 rezoning.
For this property, under the current C1 zoning, and this is why C1 was chosen, is because the church as well as the funeral home would have to cease operating. They would be non-conforming.
Okay.
This was the hardship of when we did the wholesale Transform Baltimore and has made it inconsistent. We're still finding errors in Transform Baltimore in the 7th District as we see now. There are portions of West Baltimore, and especially on North Avenue, that lost their office and residential use. And pretty soon with our community planner, we'll be coming with recommendations to change that as well, because we're trying to attract small Black businesses in West Baltimore and North Avenue. In order to do that, many of them want to apply for the subsidies offered by the housing, by DCHD to also have that opportunity. So we need the zoning for that too. So while I say that this is not hostile, this is consistent with the will of the people in West Baltimore.
Okay, where did the hostile part?
I think because the property owner is against it.
Okay. And then when you say the community wants the C1, is there an aspect of the community or a subset of the community that doesn't? Okay, the property owner. But aside from the property owner, are there other parties that are against it?
Against it, there was one person who was confused in their letter to the Planning Commission. That was it.
Okay. Okay, thank you.
Yes, ma'am.
Commissioner McCoach.
No, I have no questions, thank you.
Vice Chair Stevenson.
What are some of the, I'm not sure if you, Councilman, or if staff would be best to answer this, but what are some of the uses allowed by C2 that are not allowed by C1 that are the cause for concern in the community?
So I will be frank, the current owner wanted to house a medical clinic, a pharmacy, as well as a daycare on the same site, which also violates COMAR. He was unsure what the use was. And if we're unsure what the use was, well, then we need to have a conversation about the use. He was educated on what the uses could be, but he wanted to house all in one facility.
When you say it was against COMAR, what do you mean it was against?
So you cannot have a medical clinic and a daycare on the same site, according to COMAR.
Okay. I didn't know that.
What provision of, I'm thinking of a hospital would have daycare on the same property? So is that?
So
what-
we're talking about,
what's
you
the
mean,
distinction in yeah,
I mean, like drug treatment.
I understand, but I guess there's always codes for everything, but I'd be surprised that it said specifically healthcare clinic can't be in the same property as a.
I'll give you an example where it would fit in COMAR, whereas the Social Security building in Woodlawn has a separate building where their actual health clinic is and a separate building where their actual child care center is. They're in the same campus, but separate from each other. This is an 18,000 square foot building. There's no way to separate the campuses. Unless you're going to subdivide one building. Which is on one parcel, just being frank, so.
Right, well, okay, yes, I don't. Okay.
Real quickly, back to you, Vice Chair Stevenson. Any other questions for Councilman Torrance?
No, thank you.
Deputy Mayor Williams, any additional questions for the council?
You may have said it, but I'm sorry, so I'm sorry if I missed it. The rationale would be that there's a mistake in the current zoning.
Yes, if you look at the grammar plan, specifically pages 42 and 60,
I missed
where
it.
they
What plan?
the grammar plan, where the community wanted to have small businesses that they can walk to in walking distance, which were retail-based off of these economic corridors. This is not consistent with the retail-based businesses that they wanted. And then the proposed use is already offered at Mondawmin Mall through the village of Mondawmin, as well as several other sites around. So while it would be a saturation in one area, but that would be consistent where it should be further away from this location.
And when was that report written?
That was in 2012.
I'm sorry?
That was in 2012, and that was after 4 years of actual intentional conversations with neighbors in those communities.
And the name of that report again was?
The Greater Rosemont and Mondawmin Master Plan. I believe, if I recall from city's allocations, we spent $60,000 on generating that plan.
And that was 2012, which does precede the zoning.
Yes.
Great. Commissioner Collins, any questions for Councilman Torrance?
Just real quickly, nice to see you, Councilman.
Good to see you again, Marsh.
To boil it down for myself, what the desire to downzone this particular property is several reasons. One, because of the reports that the community put together after a lot of work. The second being the size of the establishment related to the walkability and service-oriented. And then the third is the combination of uses that are being proposed that you feel may be against state law.
Yeah, and the uses would have to go to BMZA, which will allow planning officials to work with this person to figure out what they want. I think that's a fair conversation to have with community input as well.
Okay.
Because after a while, we are looking to revitalize Baltimore, West Baltimore. You guys have seen the plan in which we use Live Baltimore, $300,000 to market to Black families come back to West Baltimore. We see that the average home price is rising around $250 in West Baltimore. People want amenities. They want to be able to walk to things that are in the neighborhood. They want to get coffee. This previously was an auto parts store.
Mm-hmm.
There are other uses that could be used in this corridor.
And just offhand, the C1, other than this particular usage that is being proposed, you don't feel that the community would be losing out on any other opportunities within a C2?
No, because your staff is eventually going to recommend a TOD1, which is consistent with C1, with some other restrictive uses. So eventually, we're going to have a non-conforming use at that location.
We can't take that into our deliberations in terms of, and for the record, for everybody who's here, the Planning Commission in this particular we are a recommending body back to the City Council. This is a City Council action. It's referred to the Planning Commission for our review and recommendation, which then goes back to the City Council, and they are the final determinant of this. So whatever we decide is a recommendation to the City Council. So although what that may happen in the future, that's great. For the purposes of our deliberations today and our recommendation, we can't take that into consideration.
And as I stand here as a member of the council, we await your recommendation, but we already know the action we're going to take.
I think there'll be a quasi-judicial hearing to just determine the ability to grant the rezoning.
And that as well as within our right as a department of this city government to have that argument here as well.
Okay. All right. So with that, are there any other questions, Commissioner Collins?
No, thank you very much.
Commissioner Jolan?
Yes, thank you, Councilman. From staff recommendation, just approval was specifically, from what I heard, spot zoning. So my question is there a reason why this entire zone is not proposed to be C1? Is there a holdup on that?
To be respectful to the Black-owned funeral home and then the Black-owned church, which would be non-conforming, I think that is the conversation. This did not happen when the previous council did spot zoning, when it changed individual lots in the last Transform Baltimore. We are basically at our own beck and call because we essentially legalized one wholesale spot zoning in the city of Baltimore when we passed Transform Baltimore.
Just for the record, if you look at this, there is a right-of-way that exists between what is designated as C2 and the C1 across the street. I think as a planner, should this be rezoned to C1, it would not constitute a spot zoning. It would constitute a spot zoning if everything around it was C2 and this became C1. That's a spot. the right-of-way that intervenes where the C1 is and the C2, that's,
The zoning goes to the
I'm
middle
sorry,
of the
Jim,
right
can
of
you
way.
repeat that for me?
so you see unfortunately I can't get there, but you see the division between C1 and C2 runs down the center of the right-of-way. Okay, so if this portion on the other side, that's currently C1, C2, becomes C1, it will be contiguous with an existing
see.
C1 piece.
Wonderful.
Okay, if all of that area was zone C2 and then just this parcel was zone C1, that would constitute a spot zoning. In my opinion, because it's contiguous with an existing C1, it would not constitute a spot zoning.
Thank
Does
you.
that help?
That
address-
helps, yes, thank you very much.
My question is, do you know when the owner of this property purchased the property?
If I recall, I think 2018, and it still has not come forward for use. In addition to that, and just being frank, there are other properties in which we are in active litigation against the owner with the Department of Housing and Community Development for
I
uses.
just want to know when they bought it, okay, in 2018. That's helpful. And I have no further questions. Thank you very much.
Thank you, Mr. Davis.
I'm sorry, I know you mentioned it, but I was looking up something. So you said TOD1 would not be desirable, or that you have no
No,
objection?
we were fine with TOD1. We just wanted to make sure that the businesses that were existing, such as Brown, who's been there for over 30 years, is still able to function, and that there's a church there, that they also be permitted uses. I'm happy to work with you to redefine what is permissible so that they are not non-conforming.
We'd have to do a study on.
Yeah.
See what was.
Yeah, I mean, what I'm hearing is that the zoning may not jive with the greater Rosemont, Mondavin, and that somebody needs to take a look
Yeah,
at this.
and
Because somebody's invested money in a piece of property with an expectation and looking at the zoning ordinance of this is what I am permitted to do.
this
that-
was, yeah.
Please let me
sorry.
finish. And now that may not be the case, even though they've invested the money to buy the property. That's an issue for me, okay? And I think it's an issue for any business who's looking to locate in Baltimore saying, well, if I buy this property and I propose something that the council person doesn't particularly like or the community doesn't particularly like, even though it's permitted under the law right now, are they gonna spot zone me out of existence? Or are they gonna, pardon me, zone me out of existence? That's an issue for me.
Yeah, and I think the precedent is that Transform Baltimore, where we saw amendments submitted by members of the city council that did spot zoning. This planning staff came with a consistent plan that members then undid. And then some of those things that we've gone back and we saw that there were issues that staff did recommend, that weren't recommended, that did not pass the council. There was hundreds of pages of amendments, right? So, and I think that this is why we're doing the comprehensive housing stuff, housing plan and everything else. I think that and not to rag on a previous council, there was no intentionality.
Yeah,
And that intentionality has placed us in places where we have to make a fatalist choice between things.
But once the zoning was done in 2017 and all those amendments were in place in 2017, and yes, I agree with you, there was a lot of things that happened in 2016 and 2017 to transform into the zoning maps and everything. They were done. They were approved. Then business came in and invested post-transform. And now something different is being proposed. That to me has a bit of a chilling effect on investment, but that's just me. Thank you very much, Councilman. Appreciate it.
Thank you, guys.
All right, is there anyone else here who would like to speak on this? Yes, sir. If you come up, please tell us your name.
Good afternoon, ladies and gentlemen. My name is Eli Lopat, and I'm the Executive Director of the Greater Mondawmin Coordinating Council. And just to follow up on what our council member just shared, with this property in particular, and I started in my role as the organization's first executive director in March of 2023. Organization's been around since 1976, but we've had the privilege to start having a staff to represent our community leaders, several of whom are in the room today. Our president of the Whittier Monroe Community Association is here, who represents the area where this property is located. About a month probably into me having started my role, I heard from the president of that association and from other folks in the community that they'd seen work starting on this property and folks didn't know what was going on, stopped by to try to find out from the workers who had started painting the place what's going on. We're told by the workers out there that there was a health clinic that was getting ready to open up. This was, I guess, 5 years after the owner in question had purchased the property, but nobody in the community had been aware of their proposed use until that time. Coming on, I'm new as an executive director. I've been involved in the community for quite some time. Was an intern with the organization 12 years ago while, folks were looking into this grandma plan that the councilman mentioned. There's been a strong vision of this Reisterstown Road corridor as, a bit of a main street of our community. We have the mall where there are these larger uses, and there's been incredible investment happening in our area with the new village at Mondawmin and the proposed medical facility there. So we're excited for these things that are coming on, and there is a vision that folks in our community have been speaking to. And I will echo our councilman in sharing that this is not the use that our community members are hoping to see along that corridor connecting Reisterstown Road and work that's happening along North Avenue with the West North Avenue Development Authority and connecting in with the Pennsylvania Avenue Main Street.
Thank you very much. Questions for the speaker, Commissioner Joel? Commissioner Collins? Deputy Mayor Williams?
No, thank you.
Vice Chair Stevenson?
No questions, thank you.
Commissioner McCoach?
No question.
Commissioner Allen?
No questions, just
Thank you.
thank you for that insight.
Thank you very much. Anyone else who would like to speak on this agenda, please come up.
Good afternoon. My name is excuse me, Leslie Golick, and I represent the building owner and the proprietor of Charm City Medical Center.
For the record, so you know, we have your letter in our material.
Okay, there are a number of letters that I've written. Could you tell me which one you have?
I didn't know there was a number. The one I have.
Well, I've written to a number of people, and it may have been copied here.
This was from April 10th, 2024 to Mr. Tiso.
Okay, very good. I don't want to belabor that, and I believe you can gather our position from that letter. First of all, this is not a proposed use. This is an actual use. There is no daycare. The use and occupancy permit was issued years ago, and a business is being operated at that location in accordance with the use and occupancy permit. It has gone through, that is, excuse me, the medical center has gone through every state and local certification and examination that is necessary. The Charm City Medical Clinic is seeing patients right now. This is a feeble attempt to deprive Dr. Kangerpain of his life's work. He has spent a decade making this medical center. The reason why we have this level of opposition has nothing to do with the Reisterstown Road corridor or anything else. It is that Charm City Medical Center is a medical center. It is a primary care center. It is a psychological help center, and it is also an addiction medicine center. And that's the objection. If we're going to be honest about it, the local community does not want to have addiction medicine services in their community. It is the NIMBY effect, and that's what you're seeing. And that's why you have this spot rezoning. Now, I don't know the details about the corridors, whether that's the case or not, but I can tell you that the bill addresses only one property and for no particular good use. There are other non-conforming uses or that would be incompatible with a C1. We just don't want to put those business owners or that facility to the hardship of being a non-conforming use. But it's okay to do it with Charm City Medical Center. Why is that? Now, what Charm City Medical Center does, and when it's up to full speed, It will take care of women's health issues. It will be primary care. It will be a pharmacy, and it is happening now. The other things that you heard the councilman talk about are in the computer business, they would call it vaporware. It is things that we're talking about doing and may happen and may come about, but in the future. I'm talking about right now. People have needs right now. They need primary care, they may need addiction medical care, et cetera. My basic objection to the bill is one that I set out in the letter, and I hope you all have had access to it, because I believe I lay out fairly well in the words of the city solicitor, not my words, the words of the city solicitor discussing a bill from 2015, how that would be an incredibly discriminatory activity in order to do a spot zoning of one property just for the purposes of shutting down medical treatment for certain patients, which is what this is. And as such, I guarantee it's going to get the city sued. And as the city solicitor, the chief solicitor in 2015 said, the federal court system could deprive the city of the ability to zone with respect to certain areas. Not only was that bill wrong, but the far and away effects of that bill, if passed, would be to deprive the city of the right to control its zoning, at least with respect to certain facilities. So I have a difficult time understanding how there is a non-discriminatory motive, a motive that does not violate the ADA, that can be used to substantiate this. As I said, it is operating now. This would be an attempt, and you know what's going to happen. They're going to make Charm City Medical Center come back to the zoning board and try to justify its use.
I don't, no, please continue.
Okay. I don't think that that's a good strategy either, but I guarantee it's what is going to happen. Whether it works or not is a different matter. But the point is, after all of this time, all of this expense, all of this investment of blood, sweat, and tears on behalf of Dr. Kangerpain, who is an 11-year veteran of the United States Army Medical Corps and a disabled veteran, after he invests this time and this effort to serve the citizens of Baltimore, to have it taken away or threatened because some people in the community don't like the kind of patients who may come to visit. It's not every patient, because that's the point in making it a broad spectrum medical center. But some of the patients will be undesirable. And because we're undesirable, because those patients are undesirable, we have to shut this clinic down. That is the entire purpose of this bill. I believe it is not only illegal, but immoral. Thank you.
Thank you. Don't leave. Questions?
Okay.
Councilman Costello, you walked in at just a great time. Do you have any questions for the speaker?
No, thank you, Mr. Chair.
Commissioner Jones?
No questions, thank you.
Commissioner Collins?
No questions.
Deputy Mayor?
You mentioned the letter, I don't know if we have, or I just have the one-page postponement request, but not the one you referenced having.
Okay. Well, I have an extra copy if you'd like.
Yeah, please.
Oh, I had to do one, but that was just that.
Okay, but there are a number of letters. I think the most complete one is the one that I wrote to the U.S. Attorney's Office. I'll give you that, and you can make copies. Let me find it.
While you're finding that, I just want to ask Mr. Tiso. All right, no, let's go back now. Anything further, Deputy Mayor Williams?
Well, I guess, are you getting a copy or me?
Yeah, they're making copies.
Okay, then, nothing further.
Vice Chair Stevenson.
No questions at this time.
Commissioner McCoach.
No questions.
Commissioner Allen.
No thank you.
So I guess my question is, you're telling me that the business is currently, the business is currently operational?
Yes,
It's currently seeing patients?
yes.
It's currently seeing primary care patients? And
I will defer, the clinic director and owner is here, and I will let him answer that. I believe it is, but he can provide details.
if I'm not mistaken, and Mr. Tiso, or Mr. Williams is a former zoning attorney, please correct me if I'm wrong, the use is operational.
Yes,
So if the property is rezoned ultimately from C2 to C1, all you're doing is becoming a non-conforming use. There's nothing stopping you from continuing the use. You just become a non-conforming use. That has certain restrictions on it. Say, for example, if you wanted to make improvements to the building, or if there's a fire, whatever happens to the building, there's restrictions on what you can do. But it's not eliminating the use. It just becomes a non-conforming use. Would that be a fair comment, Mr. Tiso and
Yes.
or Mr. Williams?
That is my,
Not
That's
asking you
as
for.
that's my personal opinion as well.
Okay. So I want to make sure that everybody in the audience knows, although I'm sure you already do, that everybody else in the audience knows that the mere rezoning of this property, should it happen, which is entirely in the discretion of the city council, will not change the use of this building. The building can still be used exactly as it is being used. It just becomes a non-conforming use under the zoning code.
thank you.
Thank you. No further questions. Thank you very much, sir.
Thanks very
Is there
much.
anyone else who would like to speak on this? You and then you, ma'am? Okay, and then I got a queue going. I got 1, 2, 3, okay? Please tell us your
Respected
name.
member of the
and-
commission, pleasure to be here. My name is Dr. Devesh Kandrapane, Dr. K for short, and I'm the Chief Medical Officer for Charm City Medical Center. I'm an Eagle Scout, a former commissioned officer of the U.S. Army Honorable Discharge, and disabled veteran, as my counsel mentioned. I wanted to set some things out, facts, and greetings to the respected councilman, honorary councilmen that are here today. Number one.
You got to take the mic with you?
Oh, I'm sorry.
Just take that mic with you.
Sure.
Point something out.
I wanted to point out to the members, this is Fingal's, which is a union sheet metal shop. It's an industrial facility. I'm well acquainted with the owners because we service the biggest unions in the country, which is with the U.S. Postal Service. This here next to it is a gentleman who goes to auctions and he stores a lot of his supplies there. Next to it is a tire shop, and that's also, a commercial enterprise. And this is us over here. And across the street is Gunnar Metals, and we've had dealings with him also on a commercial industrial basis. We are standing medical directors for the National Institutes of Standards and Technology, and we've served a lot of federal facilities, and we bring a certain kind of rigor to what we do. I want the council and the commission to know I resigned from 18 programs in opiate treatment in the state of Maryland since 2011. I have no trouble holding a job. I resigned because they were enslaving patients. We are about empowerment, and you cannot achieve empowerment when you're helping people that are battling addiction, battling mental health, battling chronic medical conditions, if you don't invest in the community. And what kind of investment? You have to do vocational assessments. If you have 25 people that want to be a mechanic, you have to be prepared as a healthcare facility to fund a garage and pay a mechanic to train those people. A nonprofit under charter cannot do that. That is the Internal Revenue Code. You can buy up hospital systems in Florida like Hopkins is doing, and the IRS will pat you on the back. That's their choice, that's the law. But nothing is saying I cannot take savings and the pennies that I get together and open up a garage, open up a landscaping business to help people whose proclivity and intention and skills is to do that. That is transforming the patient. You would be shocked to find out that in the history of the United States, there has not been one medical center, one medical clinic that is providing addiction, mental health, primary care, community medicine that is run by a board-certified public health specialist. In the history, this is the first. This center and this site was selected based on review of the Community Health Needs Assessment. It's called CHNA. I spent a lot of hours studying and dissecting those documents. That document is a required publication by any hospital that receives federal monies. St. Agnes, Bon Secours, Maryland Midtown, they all publish it. If you want to see what is in the dark closet of medicine, open it up and look at it. And it shows the ravages that are in 21217. We did not come here to mint money. It's a losing proposition if you're going to transform a patient, because you have to invest in jobs for people who are going to serve the patient. This is going to be creating 50 jobs per 8-hour shift. Why 50? Because the ratio of healthcare to patients has to be higher if you're trying to transform the patient. You can't just have one person seeing 70 patients as a therapist, as a counselor. Heather Reynolds, former CEO, Catholic Charities, Fort Worth, Texas, she's at Notre Dame right now, made a quote, "Poverty can be eradicated." How did she do that? She put 6 caseworkers on a family because she was tired of seeing them in the soup kitchen again and again. I spent, and I will not name the FQHC, with my personal cell phone, working at one of these clinics, located in 21217, 2 hours on hold with my cell phone because the patient did not have a phone because her blood pressure was 210 over 160. And I wanted them to be seen rather than going to the emergency room. 2 hours. The patient is crying. And I knew if they went to the ER because of the addiction issues, they would not get the kind of respect that maybe we would get. There is a crying need. In the council meeting, in the meeting at Greater Mondawmin Community Council, Councilman Torrance made a statement, this is a medical desert. So in a medical desert, you're going to shut down and try to do something on a promise to somebody else, and if all these things were succeeding, we have some other place to come and spend $10 million without an ounce of federal money. This is blood, sweat, and tears. Why? Because I care. I want to make a difference. One day I feel somebody's going to ask me, bigger than me, what did you do with my resources? You better have an answer. I live that every day. I'm going to be working there. When the riots happen, my wife, can you stand up for a minute, Suji? She said to me, honey, it's easy to cut a check. It's a heck of a lot harder to sit here and work. That's what set us here in 2015, not as Councilman Torrance mentioned, 2018. There is no daycare here. We know the COMAR. I'm a federal expert in the Americans with Disabilities Act. We know this stuff. We know it cold. I know what kind of uphill battle I'm fighting if I'm going to deliver results to the city of Baltimore. I wouldn't have resigned from those jobs. Who are the biggest? Acadia Healthcare, Pine Heights. Who's the second? Baymark, private equity driven, 7 clinics in this area. Medical director position. I know how to keep a job. 25 years, we were senior physicians for the Smithsonian Institution. Standing medical director for the National Institutes of Standards and Technology since 2016. I carry 2 cell phones because I monitor a nuclear reactor 24/7. It's in Gaithersburg. We know how to deliver superlative medical care. I trained at Columbia University, Johns Hopkins, Walter Reed. I would not come here to do anybody a disservice. What I find is a host and a raft of issues that violate IRS code for nonprofits, and I'm in touch with the right people about it because I'm a Fed. I was the first chief medical officer in TSA history. I save phone numbers. And when the investigations start, there'll be a lot of change because you can't rip off the public and you cannot deceive the public. This is public money. Everybody in this room who's working pays into Medicaid. You have a right to come and say, where are the results, Dr. K? I'll deliver them. This program is structured like that. I offered the councilman a personal tour of the clinic. He refused. Civic responsibility, public service is very, very important. There was a comptroller from years ago, and some of you here have seen that article. I serve the public like that. And I expect that of people in public service. We are going to be extremely vocal on the grassroots level. 50 jobs per shift in 21217 is not a joke. $1.7 million was given to a Park Heights construction outfit, person of color. Monumental fraud to the degree the DHCD commissioner told me, right?
Let's keep it
Sure.
back on the zone.
Didn't put their name on the permit. Why? Because I invested in the community. I believed in it. That's the history. So we have a comprehensive program to take care of the body, women's health, adolescent medicine, senior care, telemedicine, and of course, comprehensive primary care. We'll take care of mental health issues. You have depression, anxiety, we'll deal with that. Community medicine, jobs, education, registered nurses who drive that program. Then, if you have an addiction issue, we'll take care of it the right way. Suboxone is not the answer to every addiction problem. It isn't. The politics are immense. And then we have a pharmacy that's community-based. Why? Because they should be responsive to the way we think. In one place, under one leadership. That's how you get results in medicine. I'll take any questions.
Thank you very much. Are there questions for the speakers, starting with you, Commissioner?
Thank you.
Coach?
I did have one question.
Yes, sir.
That's not related to the zoning, but more related to the care of your patients. And I'm just wondering, after their appointments are completed, do you provide any kind of wraparound attention to people who may have received
Yeah, you got it. Get the mic.
Thank you. After appointments are completed, do you provide any wraparound services to attend to your patients who are coming to the clinic?
We do.
To what extent?
The registered nurses that are there are primary care providers in terms of case management. We also have, in our approach, community health workers. And we also work with the individuals, the patients, when they're leaving, if they're saying, I need more time, I need help with social services. We have peer advisors and peer advocates who work with them to navigate these issues. Because if we're going to transform them, we are well aware that 85% of the outcome in healthcare happens outside the clinic. So we have to take the revenues that we get from Medicaid, invest in that to help them achieve progress. That's what I'm going to deliver.
Okay.
Okay, thank you.
Commissioner, Vice Chair Stevenson.
Thank you very much for your comments and for your commitment to your work.
Yes, sir.
My question is about your patients. How do patients get connected to you and your services, and where do most of your patients live, like geographically?
Our research, very good questions. Our research has indicated there is a tremendous unmet need from south of, towards Martin Luther King, from Penn North area, all the way up to where Reicherstown Plaza is. I'm well aware, having served at Pine Heights, the issues that are going on in the 212 and 6 area. We think they're going to be coming from these locales predominantly. And the fact that we're close to Mondawmin Mall means when we deliver this kind of care, especially in primary care, individuals can hop on a bus and come and get care, and they can go.
I guess that mostly answers my question. It's a little bit complicated, but my follow-up would be, you described a complete care model, wraparound care, providing multidisciplinary support, things like that.
We must do that.
And so I appreciate that. You seem very committed to what happens inside of your facility, and that's commendable. My feeling is that the community has concerns about what happens outside of your facility. So could you maybe speak to what you see or how you intend to address that?
Absolutely. At the Greater Mondawmin Coordinating Council meeting on the 18th of November, there was a gentleman last name Kwang who happens to be the lead for another community association. He runs a deli/liquor shop at the corner of Gwynn Falls and Reicherstown Road. He asked a simple question. Who is Dr. K? He must have done something somewhere. He wasn't delivered yesterday. Do you realize that the resume that I sent, which each of you has a copy of, I'm sure, or else I'll be happy to send it, has a history that goes back to 1988 when I got my medical degree of what I've done and I continue to do for extremely discriminating clients. There is a history of performance. We want to assist the citizens. We cannot do that in a vacuum. We have to coexist in the community. Like I'm looking at you, sir, I have to look at the owner of Fingles. He's got people in the alley. I am paying for a perimeter security to make sure with facial recognition of my patients, meaning when they come to the clinic by the medical code, I have to make sure that you're the right person that I'm treating, right? So our security forces know our patients. If you're caught loitering, you're going to be discharged and held accountable. And the reason is, my message to them is very clear. For me to develop this kind of superlative care, you have to help me, Mr. Patient, Miss Patient. If you don't do that, I cannot do this because we have to coexist in society. We have to be a civic society. I can't do that if you don't take that level of responsibility. Now, if you feel you can't, I respect that, but you can't do it here. I was there at Maryland General when University of Maryland system took over, sir, to answer your question again, right? They set up a brand new camera system, everything else. I sat in the meetings every week when University of Maryland Security would bring this to program, Glass Health Programs, Medmark, and said, these are people that are engaging in activities, here are the photo shots. They were discharged. That's the kind of accountability that we have. But recognizing that we must do even more to the patient, I want to win them over by showing the love and affection of how coexisting and being in a civic society is actually better for you. You don't have to hate it if you have help to navigate it. We're going to provide that help, sir, because that's my report card. If I can't deliver that to you all, to the city, to the mayor, to the congressman, to the council, how can we do more? This will be a one-shot gun. Our history doesn't show that. We are now going on 27 years of operation in our medical company. In open market competition, we are accountable.
Thank you.
Yes, sir.
Deputy Mayor Williams.
No questions, thank you.
Yes, sir.
Commissioner Collins.
No questions, thank you.
Commissioner Jones.
No questions, thank you.
No questions, Mr. Chair.
Just real quickly, what does your use and occupancy permit allow you to do?
It's a health clinic that'll cover whatever a physician can do, the range of services, and those are the licenses that we obtain based on that from the state of Maryland, from the federal government.
And you currently have those use and occupancy permits and
Yes.
licenses and everything that
Yes.
for all your operations?
Yes, sir.
That's the only question I have. Thank you very much, sir. I believe
Thank you.
There was a woman over here, I can't remember. Yes, it was you? Yes. Yes, you were next.
So I was gonna defer to one of the business owners, but he's like my unofficial boyfriend, so I guess he's not. Walk up here.
We don't want to deal with that here.
Okay. So hi, Chris,
We have
how
plenty
are
of our
you?
own stuff to deal with.
Nice seeing you. So hi, I'm Jackie Caldwell. I'm the former president of the Greater Mondawmin Coordinating Council that I had for 8 years. It's also the president of the Whittier Monroe Community Neighborhood Association, where I've lived in that neighborhood since I was 4 years old. I'm 107 now. I own 3 properties.
Damn, you look good.
Thank you. I own 3 properties on Whittier Monroe, which is right near this property. So my brother lived next door. My mother has a house. I have a house up the street. Boom. We're a community. We're a family. That's how we live. My brother comes over. He says, Jackie, guess what? They're getting ready to put a clinic around the corner from here. I said, they're getting ready to do what? I knew nothing about it. I'm right around the corner. There was no community input, no conversation, no nothing. When I heard about it, I jumped on it. I got to Mr. Brown, who's right next there with his funeral home. I talked to Joe Jones, Center for Urban Families. I talked to New Shiloh Baptist Church, another mega church. I talked to Coppin State University. I'm on the board of NHS. I'm on the board of so many things. I don't even want to go into it, right, Chris? So I was like, you got the wrong ones here. So we reached out after I found out what was going on. Like, we need to meet with these people and find out what's going on because we saw the development and the stuff going on. We're like, what? I found out because I go to the, get some air in my tires, and the guy's gonna say something to me about it. And I'm like, what? I know Fingles too. Nothing. So I said, that's their first mistake, disrespecting the community. Because when you're a business person, and I've been one, the first thing you need to do is find out exactly what you're getting ready to get into. So you want to come into our community because we need this service where there are already 7 of these services all around the community as we see people loitering all around. My concern too is when they leave there from wherever getting their medical treatment and they lay on my mother's 88-year mother's lawn. As my brother would say that's deceased, it's not going to be a good day for you. So you're talking about security to a certain extent. How far does it go? I'm on the project up there at Target, the village at Mondawmin also. The 20 million we just put below Coppin with their high rise there. The other 12 million that's going right around the corner from there on West Side. This is not an asset to our community. This is not nothing that's going to lift people up. Yes, we know about people need help. I don't have a problem with that. I know people been on drugs and sell drugs too. This is not something that we don't know as a community, but we have brought in hundreds of millions of dollars in Greater Mondawmin. And I helped to spearhead a lot of those projects, and I take it very seriously because I still live there. And I could live anywhere, but that's where I live. It's home for me. I don't drive in and come out. I'm also the pro tem at Bethel AME Church. I don't drive in and drive out. I'm in the community for real. And I've been doing community work for almost 20 years, where, as I always say, I could be doing anything, like watching Young and the Restless. But for some reason, God said, no, you got to be my voice for the voiceless. And you have to stand up for what's right in the face of what's wrong. And this is not an asset. As far as I'm concerned, as far as my neighbors are concerned, who are 80-some years old, that live all around these properties, don't treat us like that. This is a thriving community with money coming in left and right because we are near everything. The biggest transportation hub in the city. You can get anywhere you want to get when you get to Mondawmin. We get that. But treat us like you treat other communities. Or as I always say, put it where your mother live. Put it where your mother live. If it's such a great idea, put it where your mother live. I just don't want it where my mother live. I just want something better, something thriving, something that lifts up the community. I'm on all these Bear School. I'm over there too. Treat us like the way you would want to be treated. So I'm going to let my husband, I guess, speak next.
Wait a second.
Sir.
So you're 107 and your mother's 88.
Well,
And then.
it's just a freak of nature.
They just got married during that.
And then apparently you just got married during this ceremony right here.
Yes,
Okay.
I'm busy.
All right.
And he's not the only one.
Hello, everyone. My name is Joseph Brown. I'm the owner of the Joseph H. Brown Jr. Funeral Home featuring on-site cremation. I have gotten the zoning to put in a crematory. I had to post up a sign that said exactly what I was doing exactly twice. There's a couple of things I like to point out, and one of the things is called chain link fences. Chain link fences are designed for one thing, to keep people out. One of the first things I saw coming up was chain link fence. And then I saw the steel shutters come on the windows. I know that's designed to probably not keep people out, but probably not to keep people in, but to keep people out. As a funeral home, right across the street, I will probably be investing in a lot of chain link fence. I tried to find out also. I never heard of Dr. K until recently at CFUF at the meeting. I was trying to find out what was going on across the street, and I talked to people, and they said, the workers, and they said it was going to be a clinic. And I was like, oh, a clinic, isn't that a great thing? But then the chain link fences, and then the shutters on the windows to keep people out. I will have to use chain link fence around my business to protect myself, I guess, just like Dr. K has to protect his business with his chain link fences. And his security guards, I'll have to do that also. There's a lot of traffic that comes through. And it comes through, well, we have traffic that comes through the funeral home parking lot. They'll just have to go around, I guess, because of the chain link fences. I don't know whether I'll get those steel shutters on my windows or my doors, but I will definitely have to get chain link fences. Now, this community, Greater Mondawmin Coordinating Council, council, and everyone else that is in this neighborhood really cares about what's going on, and so do I. I'm invested deeply into the community, and I'm afraid I'm going to lose some business because I'm right next door to, and I hate to say it, a methadone clinic. I'll probably lose some business and some ability to serve because of what comes along with methadone treatment. We all have to make changes. We all have to do things. I'm doing cremation. Someone said to me, you know, Mr. Brown, you have air emissions. Well, Joseph Brown is poised to be the first funeral home in the state of Maryland to offer alkaline hydrolysis, which is a non-emitting form of cremation, but the state's attorney said it was generally illegal when it was legal in 2011. So I get what you're going through and what have you, but I also get what Jackie says, you know, and I also get what Dr. K says, you know, that NIMBY thing. If you don't want a methadone clinic next to you, you don't want a methadone clinic next to you. One of my colleagues, he's having trouble putting a crematory in his community and into the community that he wants to put it in. And the community is saying, look, you can offer cremation to the community, but what about this house that I invested all this money into, and I don't want to name the community, because I don't know if that's fair to do so, but imagine living, say, 500 feet from a 40-foot stack. So that's what I wanted to share. It took a lot to find out what was going on with Dr. K's project, Dr. K, it was almost like secretive. The community wasn't aware, wasn't embracing, and did not know what was going. And when they find out, they did not know what was going on. And the same thing with me. I did not know what was going on. Thank you.
Thank you very much. Are there any questions for the speaker? Yes, Councilman Costello, for either speaker.
I just wanted to congratulate you on your nuptials. Thank you, Mr. Chair.
Mr. Chair.
Don't answer that. Just don't
Any
encourage
questions?
No, ma'am. I'm sorry. Respectfully, can I cut the line because I have to excuse myself? But I would like to ask the speaker a question.
Please.
On the chain link fence piece, does your business use or store narcotics?
No, sir.
Okay. Do you think that has anything to do with the security measures that
Yes.
the doctor has?
Yes.
Okay. And the crematorium, so congratulations
Thank you.
on that.
We'll see what happens.
I'm aware of your, the significance of the first Black-owned. Would that have been allowed if not for the C2 zoning that allows the health clinic?
That's a good question that I cannot answer.
Because I suspect that the answer is no, and I'm not 100% sure about that. But I just think that that's, and look, I'll be really candid. I appreciate the candor from the applicant and their counsel, and I, of course, as always, appreciate the councilman and the community. I live in Sandtown, Winchester myself, a community that deals with these very same issues, ma'am. So I'm usually standing on your side of the microphone. We always say that we don't want these things in our communities, but they have to go somewhere. And C2 is the place. And while you may not be sensitive to that argument, you, sir, have to be. Don't.
Of course I am. The thing is this, it was done in such secrecy.
Well, just because nothing was really done. The thing that sometimes gets lost in this is that
I didn't know they were suing patients.
Right, but the zoning was already, the reason that there was no, community process is because it's allowed by right. The tire shop next door could shut down today and open up as a health center tomorrow because that's allowed in the C2.
And there's no posting requirement, there's no
Right.
community input meeting, there's none of
Right,
that.
nothing.
You're permitted to do it as a matter of
Right, right.
So you follow the rules and the regulations that are stipulated. You're not asking for any variances or anything like that.
Right.
You can move forward without
Right.
having any community input.
Right. It needs to be changed. It should have community input. People do what they want to do, where they want to do it. It's allowed. That don't make it right.
So, under what circumstance, I don't mean to be argumentative, this really is a rhetorical question. Under what circumstance, if this use was required to have a community input, would they ever get community acceptance?
Depends on.
Would they ever go into a community and say, I want to open up a healthcare facility with primary care, behavioral sciences, and addiction services? Where would they ever, in an existing residential community, anybody ever say, come on in, you're welcome?
We have about 7 of these addiction clinics already in 21217. So we are.
Okay, that's not my.
Well, if it didn't have addiction services with it, we probably wouldn't have a problem with it.
Okay, again.
Would you? That's the truth. That's the truth.
And that's fine. All I'm saying is they're permitted to do it as a matter of right. I understand and respect your issue regarding, hey, this was done without, any community engagement. Okay, there's a reason, why certain uses are put in certain zoning categories that don't require community input. It's because they know that under any circumstance, if they go to the community, there's nobody that's going to say, yeah, you're welcome, come on in.
And I think what should make it all better, no matter where these things want to sit, is if it was done correctly. Now, allegedly, it will be done correctly. But what we have seen in these facilities, when you drive around and you see the people and the loitering and the hanging out, and it doesn't give these kind of clinics a good light. I've never seen one done correctly.
Let's
So
hope-
that's another thing too. It's like, where are they?
Thank you very much. Are there, Commissioner Stevenson or Vice Chair Stevenson, you have to, I know you have to excuse
I'm all
yourself.
good, thank you.
I just want to say, Dr. K has to have a security guard. I guess I will have to have a security guard now.
All right, so,
Have I ever heard of
hold on a
one?
second, let's just keep it. I've got these two speakers and this
I'm an
gentleman here spoke.
undertaker,
and then-
sweetheart. You know I heard of that. Come on now.
Okay, sir. All right, Commissioner McCosh, any questions for the speakers? Commissioner Allen? Thank you both. Okay.
Yeah, I guess a statement, then.
Oh, I'm sorry, I didn't.
That's fine. Yeah, statement and a question, because I guess there is case law that the discriminatory opinions of speakers can be attributed to the deciding body. So I guess I'm noting for my, I guess, personal view, and I'm noting it's relevant that the community didn't know they were operating because there was no externality, there was no negative impact, which would demonstrate that there is no impact from the operation thus far. But I guess in the council person's and the planning commission's duty to determine if it's a rezoning that we can recommend approval for, we have to determine if there's been a mistake, which is what Councilman Torrance is asserting. So do you have information about the mistake aspect? He referenced the grandma plan. Can you articulate your view of, because I'm sure you, Ms. Downs, you were involved with the grandma plans.
Way back when?
So do you have?
I don't have it, but I thought that they sent it to you guys, the grandma plan.
I have it. I'm asking you the question. I'm asking you to say you agree, outline how the C1 zoning would further the grandma plan's recommendations.
So real quickly, our responsibility is to evaluate the rezoning request in light of a specific criteria. That there's been either A, a change in the character of the neighborhood since 2017, the last comprehensive rezoning, or that when the property was zoned in 2017, it was a mistake. There was a mistake made so those are the two criteria legally that we have to weigh in on. The councilman has said he believes it was a mistake in 2017 to zone this property C2 based on the fact that you had the grandma plan that said this is what we want to do here, okay? Totally understand that. We've questioned him. We're all good to go. Do you have anything further, any other mistake arguments?
Yeah, and about the plan specifically, so I'm sure you're involved with it, so.
I'm sure you're involved with the plan, so.
I don't.
Okay.
But in any case, it doesn't kill a permitted use in the existing.
Yeah, so I guess you said nothing about I don't know, so if you don't, maybe you don't agree that the plan is impacted by the zoning designation of the property.
I think the zoning needs to be changed to C1.
Is there a reason other than the
Because it was a
addiction
mistake.
services? Why do you think it's a mistake?
It's obvious to us.
Can you help me? Can you help us or help me articulate the rationale?
Why is it a mistake?
Okay, it's fine if you don't have anything.
No.
Okay.
We feel that we are an up-and-coming community. We are doing what we can to improve the community. We don't see this as a community improvement. Was it a mistake? I think the mistake was not keeping the community informed like I had to do as a business, especially as a business that does what we do. And the clinic did not have to engage with the community in doing what they did. And like I said,
They're not required to.
They're not.
I mean, let's just make sure that we're all under the same
Okay,
page.
so
They are
that-
not required
They're not
to.
required to, so they don't have to, and we just have to
I gotta
live with
say
it.
that if well,
I think we have other speakers, so I don't want to belabor this further, but I guess the issue I'm trying to get to is on the issue of the rezoning. So setting aside the current use of the property, the question before the planning commission is to whether or not we support the rezoning of the property from C2 to C1. Do you have any arguments as to why it was a mistake to make it C2 in the first place? That's the argument. In 2017, when Transform Baltimore was enacted, it was a mistake to make it C2 and not C1. So do you have, and maybe you don't, but if you do, that's would be helpful to hear. And you might not have anything, I understand that, so.
I've been there since 1996.
Just real quickly, I don't think there's any other questions. I want to make sure that you understand.
Yes.
If this property is rezoned, the use would just become a non-conforming use. The use would stay. Okay, there would be restrictions on the use, on any future expansion of the use or anything like that. But there's confirmation that a use permit was issued for this particular use. Therefore, the use is valid. The use of the property is valid. The use can stay, and it just would be restricted in terms of its future, potential future improvements.
Can I ask you a question on just that point?
Before you do, I want to just make sure, we're getting all over the place. Before we do, I just want you to make sure that I want you to understand that is the case. That the rezoning would not necessarily effectuate the use of the property. Okay? Now, with that, yes, I'm going to get to you, ma'am.
Real quick clarification on
Just microphone, and I have a question too.
non-conforming use, and that is, if the property owner, if that business were to go out of business, or if the property owner sold, would that permitted use expire? Or does it transfer with the property?
Hold on a second. I think. Let's have the planning staff followed by the expert.
So the use is valid and can be transferred from one to the other. So it's agnostic of the owner or operator. A use is use is use. Now, mechanically, just to keep things orderly, if somebody transfers, a business or somebody wants to take over after purchasing, they'll need to pull their own UNO to get their own name and contact information on it, but it doesn't go through the review process all over again.
Even as a non-conforming use?
Right. As long as it doesn't cease, it can continue.
Okay. If it ceases, then it's done. Okay? Now, as an expert witness, Mr. Thank you both very
One more question, Mr. Brown.
Yes.
I guess, would you be open, I don't know if you've thought about it for yourself, your property,
Yes.
would you support rezoning that to C1?
I thought about that I should bring a lawyer, because I'm an undertaker, I'm a mortician. I'm not good at this stuff. I really am not. All I know is the impact that it has on my business and on the community that my business is in and the community that I share with the residents. I'm no expert. I honestly am not. I wish I was, because I could speak a lot more intelligently than I probably sound. All I can say is that I'm there every single day. Some of the questions that I have for Dr. K, well, how many hours are you going to be open? How many bathrooms do you have? How many beds do you have? So those were just some of the questions, trying to anticipate. And he came back to me. He says, well, you don't know how many people are going to come to you in the daytime when death occurs. I heard him speak about Freddie Gray. I was standing right in my foyer. And when Mondawmin was shut down, I saw people coming. And they came to the funeral home and went right around it. I'm sorry, I'm not an expert at this.
So all we ask is that you be an expert at what you do.
Thank you. I want to talk about alkaline hydrolysis. That's what excites me.
You know, and that would probably excite me as well, but right now, we've got to get back to this rezoning.
I understand.
Thank you very much.
Thank you.
Councilman, I think if you want to add something real quickly, because I've got to get to this gentleman over here and this woman over here before she tears
Yes,
my
I
head
just
off.
want to make sure, listen, I just want to make sure for the legislative record that I'm referring to the grammar plan specifically. I'm going to give you the exact pages, so I'm pretty sure someone's going to review this video. Page 66, we're looking at foster community-owned businesses and ventures in the neighborhood. That was identified for these corridors that were business interests. That is explicit and clear. A number of these businesses were supposed to be clusters. That's why I said your staff eventually will make a zoning that is TOD1, which is consistent with C1. And those operatings will be the same. Yes, Mr. K has a use and occupancy for a clinic. However, there is still undisclaimed uses. In a community meeting, he said he wanted to have a daycare center on site as well. All right? That was his words with witnesses present.
If he goes for that use and occupancy permit, you'll have.
And that's why I think that this is why I'm arguing that it should be C1 so he can go to BMZA, so that they would have to apply Colmar as well to make sure that that occupancy is consistent. There is no way to subdivide an 18,000 square foot building. Currently as it is, we're actually looking at where he can subdivide it and what entrances he has. There's limitations on entrances as well. I just want to make sure that, like,
For the record, you've stated that the specific citation to the grammar report from 2012
Yes.
that supports your justification that why this was a mistake.
yes, and then I concur with your contiguousness for C1 as well. Thank you.
Thank you very much. There was a gentleman that was over here. Was it you? Yes. Okay, thanks. I didn't recognize you going this way.
Hi, good afternoon. My name is Borna Ghaffari, and I'm a resident of 21217. I also happen to own the house, which Dr. K is developing house next door and opposite, both intended to be halfway houses. I didn't come here to...
Addresses, I guess?
Excuse me?
Is it on the same block or is it further away?
It's slightly further north.
Okay.
It is actually located right between the park and Mondawmin on Woodbrook. 3500 Woodbrook is one of his properties. 3502 is I'm sorry.
They're not part of this.
3501.
They're not part of this rezoning, correct?
Correct. So I'm just providing some color as to how we know each other.
Sir, 3500 and 3501, correct?
Correct.
Thank you.
Correct. So some facts about this place. For one, it's not one building, it's two buildings. 2220, 22240. It's two buildings, it's not one contiguous building. They were merged together. They can be subdivided. Secondly, purchased 2015, that's a fact. The fact is it used to be an auto body. Never had a use for a clinic, ever. It was made into a clinic with no permits. Fact, if you look at the permit record, converting an auto body to a clinic, no electricity permit, no plumbing permit. How can a building sustain bathrooms, patients, etc., without these things on record and existing? Which leads to the next fact. This facility is not open. I drive by every day. Everybody knows it's not open. It's not open. There's no signs of a business. There is zero indication that this building is operating. And I ask for some review to validate the claims that it is operating. There is no pre-existing use. It's new. And it was built undercover. That's the reality. That's a fact. Next, I would like to say another administrative thing. This is also a fact, and this is related to this procedure about posting. There was a testimony earlier that there was a posting. If you went there yesterday, it wasn't there. If you went there the day before, it wasn't there. If we went over the weekend, it wasn't there. I made a call to the councilman's office letting them know that the sign is not posted. That was last week. I reached out to the community association, let them know that the sign is not there. The reason being, as an active member of the community, the association, being there every day, I have not met one person who's supportive, not one. And if this meeting was in the evening and perhaps the sign was actually posted for the required time, there would be 1 million people here.
Just so you know, the fact that the question regarding the posting is actually detrimental to the request to rezone this property.
There is no posting. Drive by today, you won't see it. And if you pull any camera, maybe perhaps from the funeral home, perhaps from the funeral home, or even Mr. K's own cameras, you'll see no sign.
Okay.
And you can see who took it down, which
So that's what I was gonna ask. I thought he was saying it had been posted and someone took it down. Is that what you're saying?
it was taken down long before this meeting. It was posted for 2 days and removed.
Okay.
Which
So-
is a different.
With complaints. Personally, 2 complaints, and the sign was not put back up.
So here's the deal regarding the posting, just so that we're all clear. The commission has 2 choices, okay? We can either waive a requirement for continuous posting. We've had testimony by the planning staff that they posted the sign on the councilman's behalf, or which is the applicant's behalf, against the property owner. And he posted it, and that sign was removed and not posted for the necessary time, so we can waive the posting for that. Or
You
we
can, but the writing is on the wall. The fact that this whole thing is secretive.
You can actually let me finish
Oh, I'm
first.
sorry. I apologize.
Okay, so the second option is for us to postpone this hearing. Okay, which I am not gonna do. Because it's not, we'll be back here in however many weeks going through the exact same thing again. So, thank you very much for the notice regarding the posting. When we get to our deliberations, we're gonna have to include that one.
Mr.
Now,
Chairman,
please, yes,
I think there are 2 layers to that. I think there's a little misunderstanding about what that means.
please.
But I think there's also an idea that the person or people that
Remove the sign.
would benefit from the zoning remaining the same may have had something to do with the.
Oh, there's no question in my mind, your allegation is that the property owner removed the sign. Okay, there's no question about that. I think that's pretty obvious. Whether or not he did, I don't care, quite frankly. It was posted, and now, because we've had a public hearing, obviously there's plenty of people here for that. Yes, if it was at night, there may be, I doubt 1 million, but may be a lot more people. That would be the case with every one of our hearings, every single one of our hearings. But we run our meetings at this particular time of day. So because of your comment, I'm going to ask the commission, first and foremost, whether or not we want to waive the posting requirement, which hopefully we do, and we can continue on with our deliberations. Again, we're just a recommending body, so please continue on.
I apologize for cutting you short, by the way. Yes, just to reiterate, this building had no prior use of being a medical facility. It was made into a medical facility without the appropriate permits, and no prior use existed. It is 2 addresses, not 1, 2 buildings that merged together, and now it's so big that we have no choice but to make it C1. Interesting. And then the other thing I would say about community concern, I think it's not just related to the use. Everybody knows that this is a place that distributes synthetic opioids. There's no question about that. The doctor's history of employment as an occupational therapist also is a testament to what is the use of this. But as of right, he can do whatever he wants, that's fine. I'm not here to debate that. I am here to debate something else though. There is credibility and there is honesty about intentions. And I think that I can swear on my child and more to say there's strong reason to say that the doctor is not to be trusted. I'll give a few examples.
We're not.
That's fine. That's fine. I think
not going down that
it's a color, it's commentary on what is being said today versus what will transpire tomorrow.
And I appreciate that, and I clearly understand, why you you have your beliefs in that. Those don't weigh into our decision is based on really simple, unfortunately, really simple law, which was there was either a mistake that was made in 2017 when this property was rezoned or was zoned C2, or there's something that's happened in the neighborhood between 2017 and today that justify this rezoning. That's the only thing. Everything else that you're saying is very, very, it helps fill the picture and all that kind of stuff. But at the end of it, when we make a decision, we're going to say yay or nay based on the fact that we do or do not believe that there was a change to character of the neighborhood or there was a mistake made. So I don't want to get into the specifics regarding that. But
In my opinion, C1 does not make sense there. It's two buildings. They've been merged. Now we're saying it's too big.
so I'm confused. Are you for the rezoning or are you against the rezoning?
I am against the rezoning.
Okay.
I am against the rezoning. These are two addresses. It's not one building. It's not.
So you think that the property should stay C2?
It should stay C2. It doesn't.
You have confused me for the last 10 minutes.
Why?
I have been thinking the whole time that you are against this rezone.
Oh, okay. Yes. Sorry for the
No. Was I the only one?
He just said it should remain C2.
Sorry.
Huh? I'm sorry.
Oh, I'm sorry. I'm sorry. No. I'm sorry.
You want it to be rezoned to C1?
I am against this proposal to have this establishment there on the corner for
Regardless of the zone.
for whatever zoning supports this. So I am lost in the code.
And that's cool.
Yes,
understand.
I apologize about
not-
that.
It's not something you deal with every day. So.
Yes, C2, C1.
Whatever.
I'm not sure. But I will say that it is not currently operating as a clinic. It never has. And
We've gotten that.
yes, that's all. Thank you.
Thank you.
Sorry
very
for the
much. Are there any
confusion.
questions for the speaker?
Yeah, could you spell your name for me? I'm sorry.
Borna, last name Ghaffarian, GHAFFARIAN.
Thank you.
Thank you very much. Is there anyone else here with, ma'am, forgive me for not specifically putting up, please come on up.
Thank you very much. Appreciate that. Give me a minute to go arthritis got a hold on his left leg. Number one, my name is Laura Towns, and I am a certified addiction counselor through the state of Maryland. Okay? And my specialty is AD, drug and alcohol. I've been working in this arena for over 30 years. And what I found out in this 30 year, that a whole lot of people just look at people who have a disease. Number one, addiction is a disease. It's a disease of the mind, of the brain. That's all it is. And it calls you to behave in a certain manner. And you react and you respond differently from someone else who have a normal or rational mind. Okay? That's all it is. And society is not aware of it. They look at the behavior. Oh, he's sedated. Oh, he don't dress. Oh, he stick. You stigmatize them and you call them addicts and crackheads. But remember, it's a disease. And with a disease, you must take what? With any kind of illness, you must take what? Medication. That's all methadone is. It stops the craving and the sedation so you become functionable within that 24 hours. That's all it does. It allows you to become functionable. When I'm able to work, I'm able to take care. I'm able to pay bill. I'm able to live. That's all it does. So we cannot halt the people who have an addiction disease. It's not like everybody woke up one morning and say, hey, guess what? I want to become an addict. Trauma, pain, and emotion cause addiction. Like they were just speaking inside the Northwest and on the Madamas area. I was born and raised in Baltimore. Right there in that strip, Madama was the highlight of our Saturday. That's all we went to. Was the only dominant black mall we went to. That's it. Providence Hospital was the only dominant black hospital we had other than Lutheran. 30 years later, we don't have no hospital. So these people in Northwest Baltimore got to travel either to Life Bridge, and you can't get on the bus for $4 and come to the treatment center. How in the world are you going to get $4 and go look for medical treatment? Physical, biomedical, physical impossible. So bringing this program into the West Baltimore is accommodation that you meet everybody who have addiction, disease, need. This is what they need to function. This is what they need to survive. And you got your counselor man, you got your community people out there. Oh, I don't want this in my neighborhood. But let it be your child out there laying on the street because someone shot them or killed them. You be the first one out there yelling. The dope dealer took them out. We trying to prevent. And with Mr. Brown, the Freeman home, we are called harm reduction. And still he burns 60 down people a month. We trying to reduce it down to none. OD, overdose. Okay? So that's what I'm getting at. Overdose is very high in Baltimore City. We are here to prevent a death. He buried him. He makes a profit. We don't make a profit.
We're not.
Okay, I'm just saying. But the bottom line is, by me working in this field, I know what the clients need. They tells me what they need. This is a wonderful, and this is the only program that I heard that's offering and rendering the service that meets the need of an addict. All a need for one umbrella. If I tell one of my clients, you need to go to Braxton for mental health, I ain't got no money, Miss Town. Do you got a token? How I'm going to get there? So guess what? Without one component, you cannot have the other. Mental health and addiction are cohesive. They go together. So if you neglecting the mental health part, I can't help you with the sustenance. I'm still going to stay stuck. But at least what Dr. K is offering, everything in a one-stop shop. None of them don't have primary care doctor. When we do the assessment, when they first come into a program, the first thing you must do, and that is an assessment. And you ask them who your primary care doctor. I don't have one. Do you have any health concern? I don't know. Then by the time we bring them in, we find out that they got heart trouble, they diabetics, they high potential. They been walking around using drugs that suppress the illness until they stop using, then the real illness shows up. But had they had access to a primary care doctor, they would have been okay. Their need would have been met where they are able to be functional and still allowed to tap into resource inside your community. They can be able to go and get a job and maintain it. They can feed themselves. They can feed their family. So I just want this community to know that we are hindering them. The people who have an addiction is a disease. That's all it is. It's just a disease. And who we deprive them from help? Because you don't understand their disease. You scared of them. They don't look like me and you. That's the reason for we get denied from help. That's all I had to say.
Thank you very much. Are there any questions for the speaker? Thank you. Anyone else like to speak? Come on up.
Good afternoon to everyone. Good afternoon. How are you, Councilman Costello? Good to see you too. Good afternoon to everyone. And as president of Greater Mondawmin Coordinating Council, I want.
Tell us your name. Unfortunately,
Oh,
we
I'm
don't
sorry.
have the pleasure of knowing you like
You know, see, Adeline Hutchison, and I serve as the president of the Greater Mondawmin Coordinating Council. I worked with Councilman Costello for some years ago.
Ms. Adeline, Mr. Chairman.
Yes.
And Commissioner Collins, you were both on the Stormwater Oversight Commission that I established. Ms. Adeline served with us. It was many, many moons ago.
It was. Thank you. One of the things that I wanted to advise you of is that, like I said, I serve as the president of Greater Mondawmin Community Organization. And the young lady that got up here and spoke just now, she don't live in the Greater Mondawmin community. So if she's talking for a center to support individuals, I agree with that. But if you're not in that community and you don't know what some of the issues are that we have from your clients or the patients, then you can't speak toward our concerns. You can only speak toward the concerns that a health individual would have in some other areas. Okay, the other thing is, as they've said earlier, and our executive director has made it very clear that we did not know what was going on in that building, and a letter came out or information came out, and November the 18th was when we met with the doctor and any staff that he had that day to come over. And at that point, just to make it nice and short and sweet to the point, we had about 30 community members or more there for that day. And there was, I don't know of anyone that approved of having that clinic there because we knew that we were working with contracting company White and Turner, who had purchased the Target over at Mondawmin. And since he purchased that, we know now that there's contracts ready for PACE to come in there to support our our senior residents. The University of Maryland going to also be a part of that, and they'll be coming in there, picking up the residents, bringing them into for treatment and other health services that they will need for the community. So to have another medical center and a pharmacy on Ricestown Road is a little asinine. We don't need it. Across the street from this location is a pharmacy. That pharmacy services the individuals in the Greater Mondawmin area, Parkway, Whittier Monroe, and also a Panway area. So we really don't need another medical center there. And if this medical center is not secured like it should be, then as the funeral director has indicated, we're looking at barbed wire or some kind of wire and grates across the windows and everything else, but we don't need anyone in there bringing this in because we have it. And I know that the village at Mondawmin will definitely support anything that any of the individuals in the Greater Mondawmin community may have that we need services for. Thank you.
Thank you very much. Is there any questions for the speaker? Thank you.
Take care of yourself.
You too. Pleasure meeting you. Is there anyone else who would like to speak on this agenda item? Seeing no hands, I close the public hearing. It might have been a little quick. No, I'm sorry. Is there anyone here who would like to speak on this? Okay. Seeing no hands, we'll close the public hearing. So, questions, comments, deliberations amongst the commission?
Yes,
Yes.
thank you. Chairman, I'd like some clarification for some stuff from either other commissioners or from you. So for me, I'm seeing we are voting on whether or not this is a mistake. I think that's what I'm hearing. And then in order to rezone this to prevent a use, different use, whichever way you want to look at it. However, there is an existing UNO of using this place as a doctor's office as it stands today. So what we are going to be voting on, if we do agree that it's a mistake, is that as a matter of what happens in the future for the use of this building, not its current use that it is today.
Correct. That's correct.
Okay, all right, that's all I wanted. Thank you.
Any other questions or comments?
I'm sorry.
No, please.
Well, I don't know if Tarek already left. Oh, no. Well, I don't know if you know the answer to this. The actual property, or maybe someone else knows, the property owner, I know the operator is Charm City Medical, Inc. Do we know who the principal behind the owner, which is Tava something, sorry, I don't know, I'm embarrassed.
That would be Dr. Kanjapin.
Thank you. I guess for the record, Dr. Kanjapin. Okay.
Oh, you just wanted to know if he was.
Anything else? So I have a general comment more for the public than for the commission. This is one of those damned if you do, damned if you don't. Okay, I mean it's one of the natures of land use. It's what we call LULUs, locally unwanted land uses. Okay, nobody wants to have a drug treatment facility in their neighborhood, but it's permitted by right. But they didn't talk to us. Well, there's a reason why these facilities don't go out to the community and say, hey, listen, I'm opening up a drug treatment facility here, just want to get your input. Because they know nobody's going to say, hey, great, come on in. Can you put a nice facade up? No, it's just going to say, we don't want you here, okay? This use is permitted as a matter of right in the C2. There's a valid use and occupancy permit for this use. Although I understand and appreciate the community's concerns, the effect of this rezoning is going to be nil in terms of the actual use. And finally, we are just a recommending body. Although I appreciate the councilman's claim that or the councilman's contention that the 2012 Greater Rosemont Mondawmin area report stipulated specific things. That was 5 years before the rezoning, so there's a lot of intervening time between 2012 and 2017, and it doesn't cut the mustard, in my opinion, for a mistake. So I would personally approve or recommend approval of the planning department's recommendation for disapproval of this, recognizing full well that we are a recommending body. It's going to go back before the council, and they're going to make their decision as they will. Any other comments, discussion points? Hearing none, do we have a motion?
Well, I mean, I guess I would co-sign your sentiments generally and recognize the community as experts in zoning and the land use issues. I do think the focus and the council hearing and the future iterations of this should be on the actual land use and zoning specifics and not the fear, especially perceived, if it's not happening currently, about the potential externalities of the addiction treatment, recognizing that's an issue around the city and the country, that there's a need for it, but we need to think through policy-wise on how to prevent the externalities in a way that's good for the community. And as Mr. Tisa often says, it's about like we think about licensing or think about things that can be in place to prevent bad operators versus the use or the zoning in place. So
I sincerely hope there's an opportunity for the community and this facility, its owner and operator, to kind of come together. And when you see something happen, you bring it to the light of the owner, because you can't be there 24/7. You bring it to the light of the owner, and if nothing happens, then you start to engage enforcement. Okay, then it really becomes an enforcement issue. But ideally, there is a good relationship does build from this. So.
And I would, I guess, add that my sentiment is I would support a broader rezoning of the area, including the funeral director and the whole block to C1, because there is benefit to walkability, like in the Rosemont plan, and even TOD, because I think the whole area should benefit from Mondawmin being a major transit hub. But so that's something that would, in my opinion, withstand legal challenge, because that would not rely on the change mistake rule. So that's where, if that came before us, I would support that. But I guess on the specific request before us, I'm inclined to oppose the rationale too.
Any other questions, comments, discussions? Yes, Councilman.
this is clearly a complicated one. We've heard a lot of testimony today. I believe that in terms of specifically whether there's grounds for a rezoning, I tend to disagree with my colleagues and believe that under the legal definition, there is grounds for that. That being said, I do have concerns based on the community testimony that I heard today in terms of the level of outreach that the operator has conducted. So I would, one, I want to note that we are purely advisory today. So this matter is not concluded after today. Again, to reiterate what my chairman and several other colleagues and planning staff have said, our role in this matter is to provide a recommendation to the city council. What we decide today is not binding, it is not absolute, it is merely a recommendation. And the council is going to do what the council does. I would encourage the operator, property owner, et cetera, to really re-engage in a thoughtful way with this community. This is a really strong neighborhood, and I think there's high expectations for solid community outreach, and I think that that's warranted. And this community deserves that. And I hope that you're going to be committed to doing that moving forward, like starting immediately after this hearing and engaging with these ladies from the community and the owner of the funeral parlor to make sure that what you're planning to do is going to be done as a good neighbor and is going to be consistent with the standards that this community maintain. And I see you nodding, so I can only assume that means you're in agreement with that. So thank you for the opportunity to share my comments, Mr. Chairman. I appreciate it.
Of course. Anyone else? Do we have a motion?
Trying to avoid the double negative.
The motion would be to support staff's recommendation that disapproval of the rezoning.
Right, yeah.
For the reasons stated and is identified in the staff report.
Very good. Thank you.
So
What
was
he
that,
said.
was that motion made by Commissioner Coach?
Yes.
And seconded by anyone? Need a second, otherwise it dies.
Second.
We have a funeral. Okay.
Second.
All right, thank you. All right, again, not to push this, but we need 6 participants to vote the same. So with that, Mr. Secretary, call for the roll.
Robin Allen,
I vote against the
motion.
motion.
Marcia Collins,
Mr. Chair.
Wait. When you say you vote against the motion, you want the rezoning to go through?
Yes, and I've counted, and I'm very aware I'm the first one, so I feel like I have
We'll come back. If we need to come back,
a
we'll come
certain
back.
privilege to take that stance.
So the just to clarify, I know all this, but I just want to say it out loud. There's a proposal in front of us to rezone the property.
Right.
Planning staff is recommending that we do not do that.
Correct.
The motion that is on the table is to adopt planning staff's recommendation. So by voting yes on the motion, you are saying we should not rezone. If you vote no on the motion, as Commissioner Allen did, you are saying yes, we should rezone. I just wanted to.
And for the audience's clarification, it takes 6 commissioners to vote. We have to vote the same way in order for it to move from this body back to the council. Otherwise, it's stuck in purgatory until we vote,
And you
which
have,
will be done, by the way, today. So it's going to be a short purgatory.
you have a vote, correct?
Yes, I do.
Okay.
So, but there are,
I was clear
yep. Okay,
in
so
my
you're voting
understanding
against the
when I
motion.
made my vote.
Okay, Mr. Secretary?
Marcia Collins,
Approve.
Eric Costello,
I vote no.
Claudia Jolin,
Disapprove.
Doug McCoach,
I support the recommendation of staff.
Justin Williams,
Now, I'm confused too. Vote to approve the motion.
and Sean Davis.
Approve the motion. That gets us 3-4. So, okay. So it doesn't move on. So we got a choice. Would anyone like to make another motion at this point?
And I'm assuming there's the potential for an additional motion after this motion, correct?
Unless it wants to stay here, which I really don't want it to stay here, I'd like to move it back to council since, again, we're just a recommending body.
So I will move that we not adhere to staff's recommendation.
So your recommendation is to approve the rezoning from C2 to C1.
Yes.
Okay, and that recommendation is based on the testimony that was given, provided that there was a mistake in the last comprehensive reason. So,
Based on that justification.
do we have a second to that motion?
Second.
Okay, so we have a motion and a second. Mr. Secretary, will you call roll? I'm sorry?
Point clarification.
Yes, please.
So in this motion, are we adopting a findings of fact of a mistake?
We're adopting the findings of fact. Again, I'm speaking for the person who made the motion. The findings of fact is that the testimony provided at public hearing that the Greater Rosemont-Mondamin Area Plan from 2012 establishes a specific feel and flavor and nature and uses and whatnot for this area, and that therefore there was a mistake in the 2017 rezoning.
Well, and also, if I may, I was convinced earlier by your statement and pointing out on the map that it may not actually constitute spot zoning,
It doesn't, so, and that's fine.
and therefore not a mistake. If it is correct that
Two are
burden
separate.
of proof
Two are
for-
separate.
okay.
I mean, you can have a mistake argument, and it can still be spot zone.
But I thought I heard you say that if it were that scenario, then mistake is not a necessary component.
No, I mean, you can have a mistake and have a spot zone. Like, for example, I
No.
can have a use that's been in existence, but it's a commercial use in an entirely residential area. And if I rezone it, that's a spot zone, but it was a mistake because when it was rezoned, it should have been a commercial use.
Okay.
So
straight.
they're
But-
two separate kinds of things. All
I
right,
have another point of clarification or question
yes.
on the 6 vote threshold issue. Is that in the charter or the charter?
Yes, everything is a simple majority with the exception of rezoning, which specifies 6 members if you do that.
But then by charter, can't the city council act within whatever time period if they don't have a report?
Except that the rezoning compels a report from planning commission, so law department has opined that they need planning commission to do something in order to get council to be meeting performance of sufficiency, because it's state law.
And it's 6 votes one way or the other, not 6 votes total.
I mean, you need a quorum of 6 minimum anyway, and they would all have to agree, or you could have some larger number with some disagreement, but it has to be 6 one way or the other.
Yeah, we've gone down that road.
You have to have 6 votes in the affirmative to
One way or
pass
the
it.
other.
One way or the other. Either
Yes
for
or
or
6
against it.
no.
Are there any other questions?
And in theory, you could pick an alternative zone should you choose.
I'm trying to understand that if the benefit of rezoning to C1 since if that was conceived as a remedy to make the health facility go away, that's not going to happen, nor
That's
should
not-
it. So that, so C1 doesn't, the clinic will be there.
Right.
So I'm not sure what the advantage of going to C1 is. I can't figure this out. I'd love for someone to explain that to me.
It really will have no effect.
So what the, excuse me, what are we trying to chase here?
There's been a bill, it's gone through the process, it's been, oh, by the way,
Sponsors.
yeah, before we actually, I'm gonna ask, can we table that motion? I make a motion that we allow modified posting of the property, just to perfect that, okay? That we waive the posting requirement as stipulated in the law, and the property and whatnot has been duly posted. Do I have a second?
Second.
Thank you. Mr. Secretary, will you call roll?
Robin Allen,
Approved.
Marcia Collins,
For the sake of moving it on, I'll say approve.
this
The
is for the
waiver.
posting,
For the
Jess.
waiver.
Yes.
Eric Costello, Claudia Jolin,
Approve.
Doug McCoach, Justin Williams,
Similarly, Commissioner Collins, I'll vote yes to move it along. I don't think we had the factual or like under oath statement that the posting didn't actually happen, but you gay.
and Sean Davis.
Approved. Right, now that's out of the way. Now let's get back to the issue of the rezoning. Yes, Commissioner McCoach, I agree with you. I don't think this makes a factual difference or a real difference in what's gonna happen. However, it is a bill that was introduced to the city council. It was referred to this commission. We have a responsibility to make a report back. I think that the record will show that, our positions on this, and we have a responsibility to report back. So, there's been a motion that's been made, it's been seconded. There was a couple of points of clarification. Let's just call the roll.
Robin Allen,
Okay, not to belabor, but I will go ahead and vote. The vote is now,
against the staff report.
okay. I wanted to just take a stand for the community and the points that were made about wanting to be heard and so forth. I am very much aware of all the points that were made, even from a personal standpoint on both sides. I want to move this forward, and I was aware that it would not make any difference, but I just wanted to make a point.
Okay. So you're voting for the motion as presented by the councilman and seconded by the commissioner, Jolin, which is to
Go against the
Against
staff
the- go
report,
against the staff
which is against the rezoning.
Finding of facts, finding of facts of mistake.
Yes.
Yes.
Thank you. Marcia Collins.
Okay, I am going to vote yes so that we can move this, not because I necessarily agree with some of the foundations on both sides, but I want it to advance, so I will vote yes to support the motion.
Honorable Eric Costello,
I vote yes.
I thought you were going to say no, and I was going to
I gotta get up and punch.
Claudia Jolin,
Approve.
Doug McCoach,
I'm sorry, I just stand by the recommendation of staff. I don't think this is the right solution. I appreciate what you just did in terms of moving it forward, but I don't, maybe in the end it won't matter because the ultimate court for this will be in city council. So.
That's going to be the ultimate court for this one.
Well, yeah, really. All right, in the interest of moving, I'm going to change my vote, and in the interest of moving this forward to city council, I will vote against the recommendation of staff in favor of the rezoning. And We'll
Duly
stop
noted.
there. Just get stop there.
Yes.
Thank you. Justin Williams.
Since I have the flexibility to vote no against the motion without slowing this down, I vote no on the basis I stated before that I would support the more comprehensive rezoning of this region, but not the piecemeal rezoning proposed in the legislation.
So in your vote, you have assumed that I am going to take a position which now you forced me to take, which I greatly appreciate. Let me turn the mic off for a second. No, so in similar to Commissioner McCoach and Commissioner Collins, I am voting for the motion as it presented, although I do so unwillingly, but I'm going to do it so we can move it on. Motion passes. Yes?
Just for clarification, since we do have to write up the cover memo, and just for sake of clarity, would you like the cover memo to reflect the first failed motion?
Yeah.
Thank you.
Okay. Everybody comfortable with that one? Thank you very much.
Call the vote.
It's done. We're done with that. We're gonna take a couple-minute break. Order. It is now 3:47. We have 3 more agenda items, starting with agenda item number 10, Mr. Secretary.
Agenda item number 10 is City Council Bill number 23-0455, zoning conditional use conversion of a single-family dwelling unit to 4 dwelling units in the R8 zoning district at 1127 North Caroline Street in the 12th Councilmatic District. Eric Tiso will present.
Mr. Tiso.
Thank you, Mr. Chair. And the ticker appears to, maybe it's out of juice. Oh, is it? All right, if you can advance for me, I'm sorry. So that we are here for a conversion of 4 dwelling units, owing to the fact that we're still on the 130 docket. With your permission, I'm going to move through this somewhat briskly. Carry on. One more. That's the property. It's the second one in. This is it from overhead, and we'll wander through a couple of other slides. So it's that second one from the edge. It's quite a large building, relatively speaking, compared to what we normally see for other conversions. So for the conversion standard, and I will note that unlike many conversion bills that you see, this one does not have variances. It's a big lot, it's a big building, it well exceeds all of the requirements per the zoning administrator's referral letter. I will highlight, because I did get a question at the beginning of the meeting from one of the commissioners, on the first floor, on the front of the building, it looks like a space that may have been a 5th unit. I asked the applicant about that just to make sure, and that's going to be the rental office. So there will be an on-property manager for the building. So in case you notice that in the floor plans, that's what it is. So looking at the conversion standards, staff has reviewed this. We believe that it's better than most requirements that we get in that it does meet all of the bulk requirements for zoning. Go ahead. So I go into it a little bit more in the staff report as to how we meet those, but again, you only need 1,500 square feet in gross floor area. This has 4,000, including for the 4 one-bedroom units, a total of 3,000 square feet in the building would be required. It well exceeds that. The property is 27.5 feet in width. That suffices for 3 parking spaces across the back, which will be provided and are there in the rear yard. Therefore, no variances are needed. And for that reason, we recommend approval.
Are there any questions for Mr. Tiso?
And if that was too fast, I'll do it again.
No, please do not. Please do not. All right, any questions for Mr. Tiso? Councilman Costello?
Nope.
Commissioner Jones?
No questions, thank you.
Mr. Collins?
No questions.
Deputy Mayor West?
Questions?
Commissioner Allen?
Nope.
Move to approve.
Gotta go through a public hearing first.
Move to approve.
All right. Thank you very much, Mr. Tiso. Is there anyone here who would like to speak on this agenda item? Please.
The applicant is here if there are questions.
I don't think there's any questions.
All right, seeing nobody close the public hearing, do we have a motion?
So moved.
Second.
Move to approve staff report.
Second.
Thank you very much, Mr. Secretary. Will you call roll?
Robin Allen.
Approve.
Marcia Collins.
Approve.
Honorable Eric Costello. Claudia Jolin.
Approve.
Doug McCoach is not here. Justin Williams.
Approve.
and Sean Davis.
Approve.
That's 6.
That's 6.
Yep.
Also a record.
Oh, no. Moving on to our next agenda item.
Next agenda item is the Market Center Strategic Revitalization Plan.
So I'm going to ask
Caitlin
staff,
Audette will present.
I'm going to ask staff to do me a favor from henceforth. This is an important revitalization plan. Let's move these kinds of plans up to the front of the agenda.
Oh, I was telling him to do it at the end there.
Were you?
Yeah.
Yeah, I would move to swap it, so the street closing seems minor, or maybe it's not, I don't know.
It won't be.
Okay, well, fine.
And they know why.
No, I'm just saying that, I mean, unfortunately, after 3.5 hours or almost 4 hours of the commission being here, I mean, this is an important plan. A lot of thought and whatnot has been put into this. There's people here and whatnot. I think we should move these kinds of things up to the beginning of the agenda to take, where we're all, juiced up for it. Now we're all beaten down for it, just for future. With that, Ms. Audette.
Thank you,
Please.
Commissioners. So today I have, I'm going to keep my portion very brief and let the Market Center CDC folks do the bulk of the presentation. So I'm just going to go quickly through some of the requirements. So here's the Market Center area. It's on the west side of downtown. This is part of the policy regarding Planning Commission recognition of plans, where the Planning Commission can formally accept a community managed plan. And so that's what we're here to do today. Staff has found that this meets all of the requirements within that policy. Work began in the summer of 2018 with Market Center CDC staff and volunteers. It really kicked up in January 2019 when an advisory group was created. After a pause during the beginning stages of the pandemic, progress continued with a multitude of meetings that culminated in November of last year, when the finalized draft was presented to over 60 folks at their annual meeting. This is the elements of the plan, just the highlights here. So as required, it has visions and goals and implementation tables. It also includes a history of Market Center, which has a very robust history. And from equity standpoint, this plan identifies short and long-term actions, and it could inform city operational and capital actions within the boundaries of, not Baltimore Highlands, sorry, Market Center community. And a major focus of the plan is on current and future housing in the neighborhood, specifically strategies to keep the neighborhood affordable for existing residents. Notification, the Market Center CDC, Seton Hill Neighborhood Association, Mount Vernon Belvedere Association, Downtown Partnership, Bromo Arts and Entertainment District, and many individuals were notified. The applicant posted 3 signs throughout the district, and letters of support were provided from the Mount Vernon Belvedere Association, Harris Cook for Architects, and TriStar Group, as well as the Seton Hill Community Association, which I did not get their letter until this morning, so I apologize for not including that on the Wix site. So I'm gonna step aside and let the folks from Market Center continue the presentation. I'll pull up their thing in just a second.
Thank you, Mr. Chairman. I just wanted to provide some brief remarks. I have to leave for another engagement. I was hoping that we were going to get to this one earlier. I just want to take a moment to thank the folks from the Market Center Merchants Association. Mr. French provided me some information in advance, which I've had a chance to review. I know a lot of time and effort has gone into the development of this plan. I'm fully supportive of this plan, and I would respectfully ask my colleagues for favorable consideration today. Market Center Merchants Association has been doing some really critical work in the area around Lexington Market. And I think that the neighborhood is certainly better for their efforts. So, Mr. Chairman, again, thank you for the opportunity to say that, and thank you to the folks from MCMA. Thank you.
Thank you very much, Councilman. Yes.
Thank you so much, Mr. Casello. Ladies and gentlemen, my name is Jenny Kessler. I sit on the board of the Market Center Community Development Corporation, and I'm here to present for approval the Market Center Strategic Revitalization Plan. Next, please. Next, please. The Market Center Community Development Corporation is a 501c3. We provide support throughout the Market Center district, primarily through grant development projects. We've recently completed several projects that move the neighborhood forward, both for retail and for housing, and we are also serve as a megaphone for the community. Go ahead. One more. So as Caitlin said, the Market Center neighborhood is 27 blocks. It stretches from Madison to Baltimore, from Green to Cathedral. Next one. There are wonderful, wonderful things about this neighborhood. It has an incredible history within the city of Baltimore. There's architecture you cannot find anywhere else in the city. It is an incredible transit hub. It's very diverse. It's walkable. And it is transitioning. It has been primarily a retail neighborhood for many, many years, and it is now moving forward into something that is more mixed use and residential. We compiled some recent stats, and there are over 700 businesses, almost 8,000 workers. 21% of the almost 3,000 housing units currently are affordable. And right now, there's almost 1,000 housing units under construction, and you can see which ones are listed here. Unfortunately, for many reasons, this neighborhood has been neglected. It is currently dirty, it's dangerous, it's disinvested, and it's derelict. And currently, many, many folks in the city of Baltimore use it as a throughway. They use Market, they use Franklin, they use Mulberry, and they get in and out as quickly as they can through downtown, which is really unfortunate because we see this as one of Baltimore's most incredible neighborhoods, and it is ready for development, it is ready for change, and we can see that it's already starting, not only with the $40 million Lexington Market renovation, but as we see, there's other developments that are happening quickly, and so now is the time for an SRP. We've seen around the country, there are other cities who have transformed their neighborhoods that are historic from things that are abandoned, things that have been left behind, into tax increasing neighborhoods that grow the population, that have really restored and revitalized not only the city's civic pride, but have made names for themselves around the country. That is Cincinnati's Over the Rhine neighborhood, which also looks just like Park Avenue, if you go ahead and walk it up. Unfortunately, with a lot of these cities, they've still not been able to crack the gentrification code. As the developments increase, people come in, the rents go up, and suddenly the horse is out of the gate, and we go, oh no, what happened? Why is everybody moving out? Why don't we have these things? But we believe that Baltimore can set a new standard simply because of the size and the variability of the neighborhood itself. There's so many vacancies that there is a chance with regulation, with investment, with purpose, that this neighborhood could become a new standard for how to do development without displacement. So with the strategic revitalization plan, we have worked, as Caitlin said, for many years to bring together the community to show and be able to lobby for and advocate for changes and developments that are directly influenced by the community and for the community. So it serves as a roadmap. You all know what an SRP is, but it really does help in decision making, and we hope that not only can the city and state adopt it, but it can be something that everybody can look towards when they're considering making decisions about the neighborhood. The next slide. So we have, as Caitlin said, it's a pretty intensive plan. There's assessing current conditions, there's developing these visions and goals, the neighborhood data, and being able to back up what the goals are, and then appendices with more recommendations, priorities, and opportunity sites. So next slide. Next slide, please. There we go. So you can see the timeline, 2018 to 2024. Next slide. Over 200 participants, over 120 people. We had tons of meetings. We had great turnout. And like I said, it was presented to the public in November of 23. There are over 100 stakeholders that have been involved through the process, including big and small, and you can see some of them listed here. So we landed on 6 areas to transform. It involves both long-term significant investment and immediate short-term opportunities, which are being looked at right now. The visions we'll go through really quick, but they really are something that everybody wants. They are not unusual as we see them. It's what we want for the neighborhood. It is something that people look for and they say, yes, this is great. This is something that will help Baltimore as a whole. So really, Really quickly, I know we want to get through. Next slide, please. Within these goals and strategies, it's not just vision, but we do have implementation tables that really outline the goals and actions, how we want to accomplish these different goals, who is going to help us do these different goals, what their priority is, and where the time frame is. Because again, we know there are some long-term, short-term, there are easy wins, there are much bigger projects that have to be tackled. Ultimately, we see with every focus group, with every meeting, with every feedback, the ultimate desire for this community before we can move forward and make more complicated investments is that the neighborhood needs to be brought up to standard with other downtown and harborside neighborhoods. All we're asking for is cleanliness, safety, and infrastructure. Before this neighborhood can have more future development, these very basic things need to be addressed. And so we'll see as we go through the different visions that these come up again and again and again. So again, real quick, we've got housing. We want it to be vibrant, welcoming, walkable, and safe. And we're already seeing some of that happening. So we're here advocating for this future developments that meets our goals. And we recently formed an architectural review committee so that, next slide, when we receive requests for input and we use the SRP as a standard to go and to make decisions on our recommendations as opposed to using individual opinion. So with the economy, really the opportunity here is the vacancies. There are so many sites, many of which are ready to go, and the businesses that are here already are primarily Black-owned, they're primarily local, and it's an incredible international district. We want to make sure that any future buildings offer a diversity of options. It's not just high-end retail, it's not just catering to people above a certain income level, but there are amenities that truly make the neighborhood livable. Some of our tops, it's always a grocery store, it's a pharmacy, it's, the things that we want in a walkable neighborhood. Next, please. So we've been looking at fire code enforcements. We've been in the process of developing a welcome packet for the MCMA, so that way when new businesses come to the neighborhood, they feel a part of the community. And so again, we can see with the success of Howard Row, that's 6 Black local-owned, women-owned businesses right in a row, and that little pocket of Howard Street is blooming between the public art, between the transit stops, between the offerings that they have. It really does show a little corner of what could be possible for the rest of the neighborhood. With transportation, and again, this is bigger and systemic, but we can break it down into having it pleasantly walkable. We want everybody to be able to access it, and that even means down to the streets. Can you get a wheelchair up? Are the bricks taken out? And then, of course, the whole region wants top-notch connected transit modes because we do have one of the most connected transit hubs in the city with the area around Lexington Market. So we see this over time. We've been inventorying and working with the city to repair the broken infrastructure, and we've really focused on opportunities for public art in conjunction with BOPA, with Downtown Partnership, with many other partners to make it pretty, to make it safe and interesting to walk through. So you can see just a couple of the examples of public art within the neighborhood, which I highly recommend you walk through and see. There's a lot of wonderful things. Environment, we have these historic, one-of-a-kind buildings that have been abandoned for so long that are constantly in disrepair. We want to be able to invest in those. We want to be able to get everything back up and functioning with our infrastructure again, and to have communal green space. Green and the tree canopy, all of these things are important to build community and to make a nice neighborhood. So everything from, again, advocating for infrastructure repairs and lobbying to the CIP to developing a regular schedule of community cleanup days. Shout out to Miss Ann Winder, who has been doing this for years. We actually have one coming up on the Mayor's Cleanup Day if you'd like to come. Next slide. So we have our cleanup days. Next slide. With our quality of life, we want it to feel welcoming. We want to be able to capitalize on the amenities that are within and without the neighborhood. Market Center is accessible to dozens of local cultural sites within a mile walking distance. And for all of that to happen, it has to be truly safe. So it goes from organizing a festival that brings people in, which is what we're going to be doing in June, to creating a map for heritage tours to get visitors in and learning more about the history of the neighborhood. So we can see with the success of Charm City Night Market in 2018, when people come to the district, when you have a tipping point of population, you can see how it transforms the neighborhood from something empty and perceived dangerous to something vibrant and interesting, where people are walking around safely at night, where they're enjoying the architecture, where they're enjoying everything that the neighborhood does have to offer. And to engage the community has unfortunately been abandoned in many ways, and there's a lot of apathy. We want to be able to make it so that everyone's opinions, everyone's voices, everyone's needs are heard, respected, that everyone has a chance to be involved, so that citizens can be invested and connected to each other. So this looks like making stakeholder and partnerships, which is something that we've been doing, and really kind of reaching across to not just share and spread the plan, but to see who's accomplishing what in line with what we've got going. Kind of breaking those silos. Oh, and again, we can see that with different neighborhood meetups. Next slide. So yeah, this is it's a guidebook. It just outlines how the constituents of Market Center and how ultimately Baltimore can thrive when we take these needs into consideration. Next slide. We've looked at measures of success. Like I said, we've already gone through and we've had several different initiatives that line up with the plan that have been developed and implemented over the last few years. So we'll keep going. So between managing Bernie grants and the construction of the Meadows Pocket Park during the pandemic, to being a CHAP advisor, developing stakeholder partnerships, and we're currently doing a multi-block alley project with public art and cleanup to be able to engage the space. Next slide. But yeah, ultimately, Market Center really matters, and we're here. We're excited to be at the forefront of it. We're excited to be megaphones of change, to be able to work with the various partnerships, to work with all our stakeholders, to advocate and lobby so everyone can really truly appreciate and we can change the game. Any questions?
Great job.
Oh, thanks. Thank you.
Other questions? Commissioner Jones.
No questions, thank you.
Commissioner Collins?
I just want to compliment you on your community outreach. It's something that is very difficult to try and embrace as many people of diverse backgrounds and interests. It's challenging, and you did it right through a pandemic, so I just want to applaud that effort. It's very important, and I think the plan reflects it. Thank you.
And Kristen Mitchell and Candace, I can't remember, one of our facilitators are very, very much to succeed for that. So thank you.
Secretary.
I have a question. Yes. We know that the MTA has to convert their light rail fleet to low floor vehicles, and while they're budgeted to replace their track, they will have to change their stations. Was there any sort of vision about the future of Howard Street that came out of your planning process?
Actually, one recommendation, I think it might be in the SRP, is to consider moving the light rail station by the Howard Street dog park and the old Greyhound station down a block to where the current Howard Row is. Right now, when you go to that light rail station, you're walking a vacant block. You're walking by the Mayfair, which is completely crumbled down. It will be under construction, but it's a big gap between the existing businesses and the transit, which is a blockade for people who are coming to visit, as well as these businesses to be able to bring people in.
Thank you.
Mm-hmm.
Deputy Mayor Williams.
No questions, and just echo your comments earlier that I wish we had more time to celebrate all the work that went into it. Kind of feels like,
well, end with something fun, right?
right, but this is a lot of work, and I appreciate that, and then also appreciate even the plans, implementation, detailed level table to show how it's going to be implemented, which is helpful and something we need to do more of. And other plans that
Yeah, like I said, we really hope to be able to work with City Council, work with state funding, city funding, to kind of get some of these funds allocated, because again, it's not a big ask to ask this downtown neighborhood to be brought up to speed with all of the others.
Commissioner Allen.
You took me back. When I finished
Right?
grad school in a year I won't mention, but a long time ago, I missed New York City, so I moved to Monument Place and walked. I worked here, walked to work down Howard Street and basically through Market Center. And I'm excited to see it coming back to what I remember it being. So I commend you all on the work that you're doing and your dedication. And yeah, I'm excited.
Thank you. That's what's so exciting, right? Is every time you talk to someone over the age of 30, everybody has a story.
Yep.
Everybody has a story about Market Center. It doesn't matter. There's so many different diverse histories and stories, and so people want to see it.
Yeah, and
I
I
really wanna see
noticed
it.
Hutzler's in one of the slides, and that will certainly,
Yeah.
trigger some memories and some other people even older than I guess.
Oh, you didn't stop in for a little treat now and then, did you?
No. But also, I was with some friends recently who grew up here, who live elsewhere now. They went to the market, they were blown away.
Right,
So you all, again, you're to be commended for everything that you've done, accomplished so far, and what you're continuing to do.
Right. And think about how incredible it'll be when we can get rid of that pill market.
Yeah.
You know, when the sidewalks are safe, when there's more businesses around it. The investment for Lexington Market was wonderful, but if we don't surround that, then it's really going to lose some of its ROI, unfortunately.
So first, my cautionary note, which I have to do as a public service responsibility. I'm delighted that this is a community-based plan. It's a fantastic plan. I'm going to go into that in a second. But recognize that this does not obligate the city to spend capital dollars
Absolutely.
on specific improvements that are identified here. Now that crap's out of the way, I can tell you, I can ask, has this been embedded into our comp plan?
Yeah, I mean, so this is not something that stands alone. There is so much work going on in downtown right now through the city. I will say, me and the comp plan and Downtown Rise, Downtown Partnership, all of these various groups with overlapping boundaries have incredible plans, many of which are funded. So many of the requests that are in here are things that we have discussed. And they're things that I've provided feedback on, and they've, ideas I've taken and placed within the downtown portion of the comp plan. So I would say it's, we don't want to create too many plans that say different things. We're trying to really feed into everyone kind of being on the same page.
Ideally, since from a timing standpoint, we accept this plan that's been developed, it would be really great if this was rolled up into the downtown portion of the comprehensive plan, which would then give you more teeth to go back to our council members and say, hey, listen, this isn't just a community-based plan.
Right.
This is also part of the city's comprehensive plan. And then when you're going out there and looking for fundraising opportunities, it's not just a community-based plan, although the amount of public engagement that you've had has been phenomenal. This is also part of the city's plan as part of the comprehensive plan. So that's number one. Number two, I want to commend you on the very specific recommendations that you've outlined in the back and the timeframes and the partners and everything. It's, I think it's an essential part of the plan. It also seems very realistic. You're not asking for this, the sky and everything else. You're just saying, okay, these are some really fundamental things. The last thing I'll say is that I really hope you are successful with the displacement issue. It's something that every single community-based plan that comes before us, it's the million-dollar question: is how do you, engage and bring this community up for everybody, okay? And especially the people who have lived there during its really, really tough times, so that they can enjoy the fact that they hung around. So one of the metrics that I think you should really pay attention to is the residency, and understand, okay, if somebody leaves, why did you leave? Exactly. I mean, I would do an exit interview like you do with, unfortunately, someone who may leave your employment to really understand why they might have, if it's, hey, I had a great opportunity over here, but if it's specific about it, I can't afford to live here anymore.
Right.
That's something we got to address.
And that's definitely a threat. This is very personally important to me. I'm from Cincinnati, so I got to see and champion the rise of Over the Rhine, and we just didn't think about it, right? We were so excited. Oh my gosh, we're so excited. It's
Something's
so
gonna
great.
happen.
Right. And then by the time we thought, wait a second, wait about these people, wait what's happening everywhere else, the horse was out of the barn. And really, regulation is going to be a huge part of it, regulations and requirements. And so that's why we're so insistent on moving this forward now, because you can see the writing on the wall. You can see the developers starting to sniff around. You can see that we're at the top of the hill. If we don't get stuff in place now, then it'll be too far and too fast. But if we figure it out, man.
Yeah, no, I mean, I think that would be, you've got a lot of very important things. And just in terms of the one metric that I would look at, it would be that one. It's just to make sure that that one you're maintaining. But thank you very much.
Thank you so much.
Is there anyone else here who would like to speak on this agenda item?
We had
Y'all are good?
But I guess so.
But thank you very much for,
Oh,
yes,
Leanne.
come on up. You've been here all day.
Oh, yeah. I was caffeinated earlier. Let's see if I can talk at this point. Good afternoon, everyone. I would just like to speak to.
Tell us your name.
My name's Leanne Navarro. I'm a Market Center business owner and artist, and board member of, Market Center CDC, and I've been learning a lot over the course of several years. I've worked with the art community in Market Center, working on public programming. I would just like to say that Market Center has an intrinsic greatness towards it. And that's because there's a nostalgia and great potential. And this great potential, I think, is the key to awakening this city. So, my background is art and public engagement. Sorry, a little nervous. I'm not a great public speaker.
You're doing great.
Thank you. But, our engagement approach, working with artists, working with small business owners, trying to organize community festivals, I think that's a strength that the city has. And we're really excited to explore what is needed to activate Howard Street further. Is it trying out old ideas? Is it trying out closing down streets like Lexington? Is it trying to figure out zoning issues with egress and, building code issues where, Howard Street might be difficult to bring in new business owners because we don't know where to put the garbage because the light rail's there and we don't have a lot of alley, egress for dumpsters and such. But these are the issues that we want to bring up, and we will be bringing up through our SRP and through more organized forces. So just really very excited for Market Center and happy that our plan's being accepted. So thank you.
Thank you. And, it's interesting. One of the things I would employ you or urge you and your board to do is you clearly have a very, very willing and aggressive sponsor in the planning department. So if you're coming up with ideas and you need help, you know who you need to talk to, who can help you get stuff done. Like if you
wouldn't be here without you.
Yes, Caitlin has been wonderful.
Perfect. Thank you very much.
Yep, thank you.
Is there anyone else here who would like to speak on this? No, Mr. French.
Alumni here, I don't know.
All right. Mr. Murray.
Brennan Murray. Very quick comment. I would encourage the Market Center CDC to look at a project called Crosstown Concourse. It's essentially like our Montgomery Ward facility. It was an old Sears factory, but when you're thinking about the Hustlers building and the size of that footprint of that building and the connectedness of it, that's a project that I would encourage the group to look at. Crosstown Concourse.
Thank you very much, Mr. Murray. All right, seeing nobody else, we'll close the public hearing. Any questions or comments or deliberations? Do we have a motion to wholeheartedly support the adoption or the acceptance of this plan?
Motion.
Thank you, Commissioner.
So moved. I'm sorry.
Second.
So moved.
All right, Mr. Secretary, will you call roll?
Robin Allen,
Approve.
Marcia Collins.
Approve.
Claudia Jolin.
Recuse.
Doug McCoach is absent. Justin Williams.
Approve.
And Sean Davis.
Approve. Congratulations. Thank you very much for your diligence over the since 2018. But your work is really still going on, so. And thank you for your patience here. Yes. All right. We have one more agenda item before we
The
depart.
final item on today's agenda is a revised street closing a 13.5-foot portion of Remington Avenue between West 28th Street and Crestmont Avenue in the 12th Councilmanic District. Eric Tiso will present.
Is it 13.5 feet or is it 1.5 feet? I'm sorry. I'm getting punchy.
A little late in the day for
Sorry.
splitting hairs. Okay, again, in the interest of time, you may recall at the last meeting, the question was raised by Ms. Floyd, who's here today, and you have her letter and a photo on record, that the draft plan that we were looking at appeared that the right-of-way to be closed would need to be bigger than 12 feet. Turns out, after the fact, I was told by the applicant that is indeed correct. They had submitted a revision request to DOT that did not get forwarded to us. No mention was made during the meeting, so we moved ahead with the 12 feet. Turns out they do need the 13.5 feet, so we're here for a do-over. So that would add the extra 1.5 feet from what the commission voted to approve last time. I can walk you through all of this if you need me to, but that is the long and short of it. It was a revision that didn't get transmitted to us. So again, it's a minimal change from staff's point of view, so we continue to recommend approval.
You should listen to Ms. Floyd. Are there any questions for Mr. Tiso before Ms. Floyd comes? Thank you very much, Eric. Ms. Floyd.
I'm happy to go. I mean,
I think Ms. Hecker would refer rebuttal.
Oh, that'll be fine. Yeah, because I did write to Ms. Hecker as well, thinking that she might actually agree with me that we should defer this a little bit longer. So thank you I'm actually very, very happy to be back because now I actually have a better understanding, much better, as Mr. Peters as well, of what's at stake here. And I did, and apparently you have my photograph, and it's the only one I could get to actually upload. So really and truly, this is a 13.5 foot wide green space. It's actually a considerable size green space in our neighborhood. And I don't actually know the meets and bounds, and I don't actually know the exact overall measurements of the square footage, but the whole thing is considerable, and the portion that's green space is very considerable. And I have to say that it's the least imaginative plan anyone could think of for a public open green space in a city row house neighborhood to actually say, let's eliminate it so a developer can build over it. And not just that, but let's eliminate it so a developer can build a very tall building that will eliminate the solar benefit to a row of modest row houses in the 21st century. I mean, it's just completely counterintuitive from my point of view. And I did ask for, postponement because I am even more concerned now about the effect of your recommending this today, even more so than I was last time. I had questions last time, now I have some answers to my own questions. It appeared to me that last time this could be the first domino. And, I was sort of assured that there would be a city council bill that would come up and would give people a public process, and the people who are really concerned about this would have an opportunity then, bring their point of view and explain why it shouldn't happen and oppose the result. But as I was concerned last time, if that bill comes up years later, years after a permit is issued, years after construction is done, year after occupancy has already happened, then there's no public, that's not the process. In other words, that doesn't work. I mean, there's no voice then. The building is there. It's just a pro forma closure at that point. So that was what I was concerned about, and I'm very concerned about it now. And I know that you all, there is a process that should be followed. And I understand that. And when I was speaking to Department of Transportation, they were concerned about what I was researching, which was across the street. And as it turns out, for some reason, for this particular developer, there's another way around the process. We know it can happen because it already has happened. So again, I would say it's real green space, it's real open space. It has value on many different levels just by being that. And okay, and I don't have to go too far into that. You know the value of green space. But also this idea of, what exactly will happen on the strength of your recommending it today. And I'm very concerned about that because having done the research, you have it in your letter. What the various years of the 2014 was your initial recommendation of the closure of these other two alleys across the street. It's now 2024. And from what I can tell, we don't have a conveyance of that property yet today. Those are my concerns.
Okay.
Thank you.
Thank you very much, Ms. Floyd. Are there any questions for the speaker? Commissioner Jolin?
No questions, thank you.
Commissioner Collins?
No, thank you.
Deputy Mayor Williams?
No question, thank you.
And Commissioner Allen?
No, sir.
Thank you very much.
Thank you.
Ms. Floyd. Ms. Hecker?
Thank you, Mr. Chairman. For the record, Caroline Hecker, Rosenberg, Martin Greenberg, on behalf of the applicant. I want to thank the commission for taking this back up again. I know we had this at the hearing a couple of weeks ago, and I'm the first to admit it when I get it wrong. And Ms. Floyd was correct that there are a couple of different versions of the plan, frankly, that are being worked on because the plan has not yet been finalized. We haven't submitted anything in terms of a site plan to the city yet for approval. Our initial plan contemplated the closing of 12 feet of Remington Avenue, which is what the commission approved at the last hearing. There has subsequently been a couple of different versions. One had a 13.35 foot area of closure. One had a 13.5 foot area of closure. And we're still kind of ironing out the details, but we did submit the 13.5 foot one to the Department of Transportation out of an abundance of caution because we thought, well, it's a little bit bigger than the 12 foot one that we've been looking at. They did run their utility investigation against the 13.5 foot closure to confirm that there are no utilities that would be impacted by that are also not impacted by the 12 foot closure. And we thought out of an abundance of caution, we would like the Planning Commission to revisit this now early on in the process before city council bills are introduced about the closing, just to confirm that there is no need for a 13.5 foot portion of the right of way to remain open, similarly to the fact that there was no need for a 12 foot wide portion to remain open. We are still working on the site plans. They are hopefully getting close to being ready to be submitted, but we're not quite there yet. And in terms of the proposed building, we are trying to design something that will be within the zoning envelope of what's permitted by right on that site. So in terms of the statement that it's a very tall building, it's going to be within what would be permitted by the underlying zoning. And again, the process here is the process as it is for all right-of-way closings, where we'll ultimately go through the city council process. This is not the last time that the Planning Commission will hear this. The city council bills to authorize the closure and sale of the right-of-way will come back to the Planning Commission. So this is, certainly the first opportunity for the Planning Commission to hear it. Well, I guess in this case, the second. But it will be back to the Planning Commission again at some point in the future as well. I'm happy to answer any questions that you may have.
Commissioner Allen, any questions for Ms. Hecker?
No, thank you, Ms. Hecker.
Thank you.
Deputy Mayor Williams?
No questions, thank you.
Thank you.
Commissioner Collins?
No questions.
And Commissioner Jolin?
No questions.
Thank you.
So I do.
Yes.
So Ms. Floyd makes a great point, is that it's 13.5 feet of open space, of green space today.
It's not all green space. Some of it's it's sidewalk, it's right-of-way. Some of it is grass, that's for certain.
I mean, a walkway to me is,
It's-
when I say green space, I'm not talking specifically.
Okay.
It's grass.
Yes, it's open, it's undeveloped at this moment.
It's for public use, it's not a road.
It's for public use and it's not a road. That is correct. But there will still, we're not going to close off a public right-of-way along the side of the building. There will still be a sidewalk, appropriate landscape, streetscape, which is all still in design right now. So it's not like the new building is going to come right up to the roadway. There will still be an appropriate setback and will meet the regular city requirements.
But in terms of the green space that area provides, which right now could, is just a part of the urban relief. There's tree canopy there, albeit some pretty rough trees and whatnot.
It's not great right now, but it is not improved space, as you say. We are in connection with the development of the property, proposing to replace at least as much as we are taking away in a new and redeveloped park at the pointed end of this triangular lot, and that's also still in development. But the building that's proposed is by far not going to occupy that entire triangle. The bottom half of it will remain a park.
It would be really good to understand. I support your request, but I take heed to Ms. Floyd's comment.
It's a fair point.
regarding the green space in the neighborhood. So it'd be good to understand when you're coming in with your site plan, to do an analysis of, hey, if we were to include this, let's assume that this was part of our property, then how much green space do we have, and how much green space will we have?
That's a fair point. And the truth is, I'm sure that the Site Plan Review Committee and UDAP are going to be very interested in that as well. So I'll make a note to make sure that we look into that.
Good. Thank you very much, Secretary.
Thank you.
Is there anyone else here who would like to speak on this agenda item? Hearing none, close the public hearing. Questions, comments, deliberation from the commission? Do we have a motion? Anyone?
Move to approve. Staff report, staff recommendation.
Okay, we have a motion from Deputy Mayor Williams. Do we have a second?
Second.
Thank you, Commissioner Jolin. Mr. Secretary, will you call roll?
Robin Allen,
Approve.
Marcia Collins,
Approve.
Claudia Jolin,
Approve.
Justin Williams,
Approve.
and Sean Davis.
Approve. There being no further action before the commission, we adjourn at 4:35. I thank you all for your patience.